Lyme disease, or borreliosis, is a tick-borne infection caused by certain species of the Borrelia genus, B. burgdorferi in the U.S., predominantly B. pfeiffelii and B. guerinii in Asia and Europe. There are three stages of Lyme disease. Stage, early localized disease, is characterized by erythema migrans, an expanding circular red rash at the site of the tick bite, and may be associated with flu-like symptoms. In stage 2, early disseminated disease, patients may present with neurological symptoms, example facial palsy, migratory arthralgia, and cardiac manifestations, example AV block. Stage 3, late disease, is characterized by chronic arthritis and neurological involvement, late neuroborreliosis, with possible progressive encephalomyelitis. In Asia and Europe, further skin manifestations may also occur in stage 2, lymphadenitis cutis benigna, and stage 3, acrodermatitis chronica atropicans. Lyme disease is a clinical diagnosis in patients with erythema migrans. For all other patients, Lyme serology is recommended. Antibiotic treatment varies depending on the stage of Lyme disease and presentation. Options include oral doxycycline, amoxicillin, or cefuroxime acetyl, and, in severe cases, intravenous ceftriaxone. Post-exposure prophylaxis, PEP, for Lyme disease after a tick bite may be required in selected cases. WA. Low. Epidemiology. Scent incidence, most commonly reported vector-borne disease in the U.S. Scent geographical distribution, primarily the Northeast and Upper Midwest of the U.S. =A. References. Epidemiological data refers to the U.S., unless otherwise specified. OLHSS set ma equals as stet CE. Etiology. Scent pathogen O in the U.S., Borrelia burgdorferi, a microaerophilic spirochete bacteria equals atypical and cystic forms of B. burgdorferi can persist in the body for years. O in Europe and Asia, B. pfeiffelii and B. guerinii equals rarely B. valeriana, B. lusitanii, B. spielmanii, and B. bavariensis infect humans. Scent vector copyright various tick species, mainly Ixodes scapularis, deer or black-legged tick, in the northeastern and upper midwestern U.S. equals Ixodes pacificus, western black-legged tick, in the northwestern U.S. equals Ixodes ricinus, castor bean tick, in Europe copyright typically found in forests or fields on tall brush or grass copyright. The incidence of Lyme disease is highest between April and October, especially from June to August. Copyright increased risk of disease for, equals outdoor workers, example landscapers, farmers, equals outdoor enthusiasts, example hikers, hunters, scent reservoir hosts o deer, cattle. Operomyscus leucopus, the white-footed mouse, is the primary reservoir of B. burgdorferi in the U.S. Back collapse. Fine text outline. Clinical features. Stage, early localized Lyme disease, 21I31-4. Symptom onset occurs 7 to 14 days after a tick bite. Erythema migrans scent flu-like symptoms degree fever headache copyright fatigue, malaise, lethargy myalgias, arthralgias. Stage 2, early disseminated Lyme disease, 2I31I4. Symptom onset occurs 3 to 10 weeks after a tick bite. 5. Scent migratory arthralgia, can progress to Lyme arthritis if left untreated. Scent early neuroborreliosis E. Lyme carditis cutaneous manifestations O. Multiple erythema migrans lesions copyright Borrelial lymphocytomas Scent ocular manifestations copyright retinal vasculitis copyright keratitis copyright iridocyclitis O. uveitis 2. EEAE Stage 3, late disseminated Lyme disease, 2I324. Symptom onset occurs months to years after the initial infection. 5. Scent Lyme arthritis Scent late neuroborreliosis acrodermatitis chronica atropicans. Cue to remember important symptoms of Lyme disease. Think of someone making a face, facial nerve palsy, arthritis, carditis, erythema migrans, when biting into a Lyme. WY. OE. Diagnostics. Lyme serology 5-ll. Scent preferred testing protocol for new infections. I6 Plus detects IgM and IgG antibodies against Borrelia burgdorferi. SLL6L. Indications. Back. Equals QL. Collapse fine text outline. Indications. Possible tick exposure in Lyme endemic regions, plus any of the following: 6L, 7 scent atypically appearing erythema migrans scent clinical features suggestive of neuroborreliosis, Lyme carditis, or Lyme arthritis. 0. Lyme serology can be deferred for patients with typically appearing erythema migrans and asymptomatic patients with a recent tick bite. 6. Protocol/and-lel. Initial test, enzyme-linked immunosorbent assay, ELISA, or indirect fluorescent antibody test scent positive or equivocal initial test, confirmatory testing with a Western blot or second-tier immunoassay. OE, false positive results can occur due to cross-reactivity, example with syphilis, Rocky Mountain spotted fever, systemic lupus erythematosus, or rheumatoid arthritis. 5. Further testing. Further testing may be considered depending on the clinical presentation. ECG, see Lyme carditis. Scent lumbar puncture, LPC neuroborreliosis. Arthrocentesis, see Lyme arthritis. Scent laboratory studies copyright CBC, mild anemia, normal total WBC count with lymphopenia copyright inflammatory markers, TESRO liver enzymes, mildly elevated copyright troponin, may be elevated in Lyme carditis. 6. WA and R non-cell OS9T LIAS or AILI differential diagnoses. Scent C differential diagnosis in erythema migrans, Lyme carditis, neuroborreliosis, and Lyme arthritis. See overview of tick-borne diseases including copyright tick paralysis O Rocky Mountain spotted fever, RMSF, O babesiosis O ehrlichiosis O anaplasmosis O tularemia copyright Colorado tick fever, CTF, copyright tick-borne relapsing fever copyright Southern tick-associated rash illness, STRI. The differential diagnoses listed here are not exhaustive. WA. OXO. Treatment. Asymptomatic patients with tick bite. Remove the tick, if present. Scent provide PEP for Lyme disease if indicated. Antibiotics 61L5. Scent indications for oral therapy O erythema migrans copyright neuroborreliosis without parenchymal CNS involvement, example isolated cranial nerve palsy, radiculoneuropathy, mild meningitis, O mild Lyme carditis copyright Lyme arthritis copyright Borrelial lymphocytoma copyright acrodermatitis chronica atrophican scent indications for therapy O neuroborreliosis with severe meningitis or parenchymal CNS involvement, i.e., encephalitis, myelitis, O severe Lyme carditis copyright treatment-resistant Lyme arthritis scent. Preferred oral agents, doxycycline, amoxicillin, or cefuroxime acetyl. Back collapse fine text outline. Scent preferred oral agents, doxycycline, amoxicillin, or cefuroxime acetyl scent preferred 4-agent, ceftriaxone copyright courses, example. OS degree AE. Subtypes and variants. Overview. AJ, P after tick bite. Erythema migrans, early localized Lyme disease. Neuroborreliosis Lyme D. Lyme carditis, early D Lyme D. Lyme arthritis, late disseminated Lyme disease. Borrelial lymphocytoma, early disseminated Lyme disease, acrodermatitis chronica atrophicaన్స్, late disseminated Lyme disease. OOOIEEE. Lee erythema migrans. Description 223241. Overview of Lyme disease manifestations clinical features tick may still be attached. Red ring with central clearing expands over days to weeks flu-like symptoms neurological symptoms, example CN palsy, meningitis, headache, fatigue, fever. Bradycardia or tachycardia, chest pain, fatigue, swelling, pain in large joints, example knee, episodes may recur. Prodromal migratory arthralgia may be present. Blue-red nodular lesion often on the earlobe, face, nipple, skin changes, atrophy, discoloration, typically on the extremities. A rash that occurs in 70 to 80% of affected individuals. Pathognomonic of early localized stage Lyme disease. 13 clinical features. I3241. Scent onset 7 to 14 days after a tick bite, plus usually a slowly expanding red ring around the tick bite site with central clearing, bull's-eye rash. 1 scent typically warm, painless, possibly pruritic. Scent often occurs in isolation. Scent self-limiting, typically subsides within 3 to 4 weeks. Diagnosis. 61 scent typical appearance, make a clinical diagnosis. Atypical appearance, perform Lyme serology on acute and convalescent serum. Diagnostics. No specific testing required. Typical appearance, clinical diagnosis. Atypical appearance, Lyme serology. Lyme serology. Consider LP with CSF analysis. ECG changes, example AV block, Lyme serology. Elevated troponin. Lyme serology. Consider arthrocentesis and synovial fluid analysis. Clinical evaluation. Lyme serology. Management. Prompt tick removal as needed. PEP for Lyme disease, if indicated. Oral antibiotics, example doxycycline, amoxicillin, or cefuroxime acetyl. Mild, oral antibiotics, example doxycycline, amoxicillin, or cefuroxime acetyl. Severe or refractory, 4 antibiotics, example ceftriaxone. Asterisk. Oral antibiotics, example doxycycline, amoxicillin, or cefuroxime acetyl. Diagnostic testing is not required before treating typically appearing erythema migrans. L. Differential diagnosis. Differential diagnosis. See also Overview of annular skin lesions. Scent cellulitis, scent contact dermatitis, discoid eczema, erythema marginatum, rheumatic fever, erythema multiforme, scent granuloma annulare, annular erythema, scent southern tick associated rash, illness, STRI. Treatment, 61. Scent preferred. Copyright oral doxycycline, copyright oral amoxicillin, copyright or oral cefuroxime acetyl. O. OXO. Lee neuroborreliosis S250. S0I2TRAS. S02TI. Description, 14LLE. A manifestation of disseminated Lyme disease can cause PNS or CNS dysfunction. Clinical features. Scent onset. Copyright early neuroborreliosis, within the first few months after a tick bite, typically has an acute onset. O late neuroborreliosis, months to years after the initial infection, typically has an indolent onset. Scent peripheral neuropathy, weakness, pain, paresthesia. Copyright cranial neuropathy, most commonly facial nerve palsy, often bilateral. Copyright radiculitis, plexopathy, mononeuropathy, or mononeuritis. Multiplex. Scent meningitis, can cause benign intracranial hypertension. Scent encephalitis, myelitis, or encephalomyelitis. Copyright. There is no proven association between Lyme disease and specific neurodegenerative diseases, example multiple sclerosis, Alzheimer's disease, Parkinson disease, or psychiatric conditions, example depression, anxiety, bipolar disorder. L14. Diagnosis. 6. Lyme serology. Exclusion of other causes, see differential diagnosis. Lumbar puncture. 625. Indications, not routinely recommended, can be considered in certain cases of suspected CNS neuroborreliosis. 6. Scent CSF analysis, signs of lymphocytic meningitis, including lymphocytic and/or monocytic pleocytosis and elevated protein levels. 6. Scent intrathecal IgG or IgM antibodies with simultaneous serum antibody test, elevated CSF/serum antibody index. 6. Differential diagnosis. Scent other etiologies of meningitis, encephalitis, and CNS lesions. Scent other etiologies of cranial nerve palsies, example Bell palsy, and other peripheral neuropathies. Treatment, 61. Scent meningitis, radiculopathy, cranial neuropathy, and / or other peripheral neuropathy, treat for 14 to 21 days. O preferred equals 4 ceftriaxone equals or oral doxycycline. Scent encephalitis and / or myelitis, treat for 2 to 4 weeks. Copyright preferred, 4 ceftriaxone. OO. OE. And Lyme carditis. Back collapse. Find text outline. Lyme carditis. Description, 6LL5. A manifestation of early disseminated Lyme disease. Scent inflammation and dysfunction involving any part of the heart, example atrial or ventricular arrhythmias, pericarditis, myocarditis. Clinical features. 6LL5. Scent onset, within days to weeks, typically 3 to 5 weeks, after a tick bite. Scent tachycardia, bradycardia, pre-syncope or syncope. Scent clinical features of heart failure. Scent clinical features of pericarditis. Scent clinical features of myocarditis. Diagnosis. 625. Lyme serology ECG. Copyright conduction system abnormalities, example AV block. Copyright other arrhythmias, example ECG findings in atrial fibrillation. ECG features of pericarditis * elevated troponin equals HLZ0. S0 at differential diagnoses M equals SA20E. Scent C etiology of atrioventricular blocks. Scent C bradyarrhythmias and tachyarrhythmias. Scent C etiology of myocarditis and etiology of pericarditis. Treatment, 61. Scent mild symptoms, oral treatment for 14 to 21 days. O preferred equals oral doxycycline equals or oral amoxicillin equals or oral cefuroxime acetyl. Scent PR prolongation 300 milliseconds, high degree AV block, arrhythmias or features of perimyocarditis, V treatment for 14 to 21 days. O preferred, 4 ceftriaxone. Scent mild symptoms, oral treatment for 14 to 21 days. O preferred equals oral doxycycline equals or oral amoxicillin equals or oral cefuroxime acetyl. WA. CE. Lyme arthritis. Description. 16. Scent inflammation of the joint tissue due to Borrelia infection. Scent can be permanently disabling if untreated. Clinical features. 16. Onset, weeks to years after the initial infection. Scent prodrome of migratory arthralgia, can occur in early disseminated Lyme disease. O affects joints at different times, typically involves the bursae and tendons at onset. O can progress to Lyme arthritis if left untreated. Lyme arthritis, typically occurs in late disseminated Lyme disease. Copyright monoarthritis or asymmetric oligoarthritis. Copyright typically affects the large joints, especially the knee or elbow. O may be intermittent or persistent. Diagnosis. 6. Lyme serology exclusion of other causes, C. Differential diagnosis. Arthrocentesis. 6LL5 AEZ. Z equals. Back collapse. Find text outline. Arthrocentesis. 6L5. Synovial fluid analysis, typically nonspecific. 5O appearance, yellow and cloudy. O leukocyte count, mean of 25,000/mm. With 50% neutrophils. Copyright glucose, usually normal. Copyright arthrocentesis is usually conducted to rule out septic arthritis. Lyme arthritis is typically diagnosed based on clinical presentation and positive serology. PCR is not obligatory. 6. Differential diagnosis. Scent C differential diagnoses of infection-associated arthritis. Scent C differential diagnoses of inflammatory arthritis. Treatment. Scent initial treatment, oral treatment for 28 days. Copyright oral doxycycline. Copyright or oral cefuroxime acetyl. Copyright or oral amoxicillin. Fan 4 EISO 12 SFISTAAS 2 I1 equals 0 of OE. LL. Other cutaneous manifestations. Borrelial lymphocytoma 61. Scent description ORRA, cutaneous manifestation of European Lyme disease, endemic for Ixodes ricinus. Copyright occurs in early disseminated Lyme disease. Copyright manifests as a bluish-red nodular swelling typically located on the earlobe, face, mammae, and/or near a previous or concurrent lesion of erythema migrans. Copyright localized lymphadenopathy is common. O resolves spontaneously. Scent treatment, oral antibiotics. Acrodermatitis chronica atropicans, Herkimer disease, 6. Scent description copyright chronic progressive dermatological disease due to infection with Borrelia afzelii. Copyright occurs only in Europe and Asia. Copyright most commonly affects women 40 years old. Copyright occurs in late disseminated Lyme disease. Copyright typically involves the extensor surface of the extremities. Scent treatment, oral antibiotics. Co. RO, XO. Complications. Post-treatment Lyme disease syndrome, PTLDS. Asterisk definition, nonspecific symptoms, example pain, fatigue, cognitive impairment, lasting 6 months after successful treatment for Lyme disease/IL-171 I-18 plus pathophysiology, unknown -1, 8, asterisk diagnostics, 7 copyright clinical diagnosis based on new or residual symptoms following antibiotic treatment for serologically confirmed Lyme disease. Copyright rule out treatment failure and reinfection. Copyright inflammatory markers are typically normal. 3 scent differential diagnosis, somatoform disorders, fibromyalgia, chronic fatigue syndrome. Scent treatment, there are no established effective therapies. 18E provide reassurance, education, and patient-centered counseling. Back collapse. Find text outline. WACO, RU. Complications. Post-treatment Lyme disease syndrome, PTLDS. Scent definition, nonspecific symptoms, example pain, fatigue, cognitive impairment, lasting 6 months after successful treatment for Lyme disease. 317-1118, pathophysiology, unknown. 18 asterisk diagnostics, 7 copyright clinical diagnosis based on new or residual symptoms following antibiotic treatment for serologically confirmed Lyme disease. A rule out treatment failure and reinfection. Copyright inflammatory markers are typically normal. 3 scent differential diagnosis, somatoform disorders, fibromyalgia, chronic fatigue syndrome. Scent treatment, there are no established effective therapies. 18 copyright provide reassurance, education, and patient-centered counseling. Degree long-term antibiotic therapy has no proven benefit. Pound 1L19. Copyright after treatment for Lyme disease, avoid additional antibiotic therapy in patients with new or residual nonspecific symptoms if there is no evidence of treatment failure or reinfection. 6. Copyright many patients with PTLDS are ultimately diagnosed with fibromyalgia, chronic fatigue syndrome, or medically unexplained symptoms. 20 equals tie, we list the most important complications. The selection is not exhaustive. FOFA, IEEE. Prevention. General prevention. There is no approved vaccine on the market for Lyme disease. Avoid prime habitats in areas known for Lyme disease. Scent tick bite prevention, prevent and properly manage tick bites to avoid exposure. Wear protective clothing, example long-sleeved shirts, long pants, and light colors. Use tick repellent and pesticides. Copyright check body for tick bites. Remove ticks immediately, see tick removal. Degree observe the bite site for early detection of erythema migrans. AE. Post-exposure prophylaxis for Lyme disease 6. Scent consider prophylaxis for patients who fulfill all of the following criteria. 6. Copyright the bite was from an identified Ixodes species tick. Copyright the tick bite occurred in a highly endemic area. 21. The tick was attached for 36 hours. 151-degree prophylaxis can be started within 72 hours of tick removal. E-prophylactic regimen, single dose of oral doxycycline. OOAO. Sources. Last updated February 23, 2024. Back collapse, fine text outline. And Lyme disease, 1/1. Lyme disease. Epidemiology, sex, approximate 1.4:1, 3% reported incidence, U.S. total, 2018 7.2/100,000 exact incidence unknown. Cases concentrated in the Northeast and Upper Midwest, most common vector-borne disease in the U.S. Etiology: pathogen, Borrelia burgdorferi vector, tick species of genus Ixodes, primarily Ixodes scapularis, risk of infection increases with duration of tick blood meal. Diagnosis: two-step serological testing, initial test, ELISA, plus confirmatory test, Western blot. Treatment: oral or 4 antibiotics. Note: national notifiable disease prevention, no vaccine available. Avoid exposure. Appropriate tick removal. Differential diagnosis includes other tick-borne diseases, e.g. RMSF. Lyme disease fact sheet. Copyright Boss. Ocular manifestations, example conjunctivitis. At any stage. Early localized infection, stage I. Flu-like symptoms. Fever, fatigue / mild neck stiffness, headache, myalgia. Arthralgia. Erythema chronicum migrans, 80% of patients. Liver function abnormalities. EV / lulls. A. Early disseminated infection, stage 2. E.g., meningitis, cranial nerve disorders, most commonly facial nerve palsy, / peripheral radiculoneuropathy. Lyme carditis, conduction disorders, myopericarditis may occur. / late disseminated infection, stage 3. SS. Lyme arthritis, monoarthritis / oligoarthritis. E.g., cognitive impairment, abnormal gait, bladder dysfunction, psychiatric changes, peripheral polyneuropathy. Progressive encephalomyelitis is a rare but severe manifestation. Lyme disease. Borrelia burgdorferi AWAS, various tick species, mainly Ixodes scapularis, vector MT, stage I, 7 to 14 days. Stage IL, 3 to 10 weeks or incubation period, stage IL, months to years ID. Stage I, early localized Lyme disease WY. Erythema chronicum migrans. Stage 2, early disseminated Lyme disease EE. Clinical features, migratory arthralgia, Bell's palsy, myocarditis, UT, stage IL, late Lyme disease, chronic arthritis, progressive encephalomyelitis, equals TE. E7.2 cases per 100,000 U.S. population, 2018, annual incidence OSS. Plus, avoid endemic areas and exposure equals NM, instant tick removal prevention, protective clothing, tick repellents. At, most commonly reported vector-borne disease OSS in the U.S. / note WWS7 equals AK areas endemic for Lyme disease AS at CS equals IB highly endemic J suspected Phi SSB moderately endemic _ not endemic BRI, CO. Lyme disease fact sheet and U.S. endemicity map VV. Map based on data from the Centers for Disease Control and Prevention, 2015. Copyright Boss. Transmission. Incubation period. Clinical features. Annual incidence. Prevention. Note. Global distribution of Lyme disease and its vectors. Lyme disease, 2 halves. Lyme disease. Borrelia burgdorferi sensulato. Species of Ixodes genus. Early localized infection, stage 1 days to weeks, early disseminated infection, stage 2 weeks to months, late disseminated infection, stage 3 months to years. Stage erythema migrans, cutaneous lymphoid hyperplasia, stage IL acute neuroborreliosis, Lyme carditis, stage IL Lyme arthritis, acrodermatitis chronica atropicans, chronic neuroborreliosis. Differs depending on region, U.S., 30,000 cases. Post-exposure prophylaxis, tick removal, observe tick bite site, no vaccine available. Ticks are also vectors for other pathogens, e.g., tick-borne encephalitis virus. XUA. If DFN, SF1SEH. TY, MF distribution of Lyme disease and its vectors 7 Ta AIE at Ixodes ricinus, castor bean tick, I. Ixodes scapularis, deer tick, i.e. Ixodes persilicatus, taiga tick, by Ixodes pacificus, western black-legged tick. I. Ixodes ricinus, castor bean tick, and Ixodes persilicatus, taiga tick. No greater love IEEY equals. Copyright Boss. Data from Steer ETAL, DOI 10.1038/NRDP.2016.90. Borrelia burgdorferi. Colorized scanning electron micrograph of 3 Borrelia burgdorferi bacteria. The long, spiral rod shape of the bacteria is characteristic of spirochetes. These bacteria move by rotating around their own axis. Source, ID #13177, CDC/Claudia Molins, Janice Haney Carr, Centers for Disease Control and Prevention, CDC, licensed under public domain. Tick after a blood meal. Find this image shows a female deer or black-legged tick, Ixodes scapularis, with an enlarged body following a blood meal. The tick's mouth parts, which it uses to suck blood, are clearly visible. The tick cuts the skin using its 2 chelicerae and inserts its hypostome into the wound. The deer tick is mainly found in the northeastern and upper Midwestern U.S. It is one of the various tick species that transmit Lyme disease and tick-borne meningoencephalitis. Source, ID #15993, CDC/Dr. Gary Alpert, Urban Pests, Integrated Pest Management, IPM, Centers for Disease Control and Prevention, CDC, licensed under public domain. Euro-Lyme disease, 3/3. Sol as SA, 4's ATET. There's no greater love that frees US $0 deep within tick bite. The body of a partially burrowed tick is visible. Copyright Boss. WA equals OSAAFOEIEEEGASCRY2NE at SSIL. There's no greater love than Jesus. There's no greater love than he gives. Erythema migrans in stage I Lyme disease I. A large, primary lesion with circular erythema and central clearing on the posterior side of the right upper arm is visible. This clinical picture is typical of erythema migrans, stage-Lyme disease. Illustration, bullseye sign. Source, ID #9875, CDC/James Gaffney, Centers for Disease Control and Prevention, CDC, licensed under public domain. We _YEFIO2, AFY. _ Erythema migrans SSRNARFA, 2's ALET. There's no greater Rhodophthidiphys US 56 beep with a round, homogeneous area of erythema with a diameter of approximate 14 cm can be seen on the right shoulder of this patient diagnosed with Lyme disease. The circular expanding lesion forming around a tick bite is highly suggestive of erythema migrans, which is characteristic of Lyme disease. Source, ID #14482, Centers for Disease Control and Prevention, licensed under public domain. Erythema migrans. A circular erythematous rash with a central clearing, bullseye rash, is visible on the upper back. Erythema migrans is typically seen in the early localized stage of Lyme disease. Source, courtesy of Dr. Gary M. White, MD. Erythema migrans in stage Lyme disease ES/Mio, he. Sotsagral RIB all the world's empty treasure will soon pass away. Localization, posterior side of left upper arm, lesion, oval-shaped, expanding erythema with central clearing. Red tick bite in the center of the erythema. Source, copyright IMPP. Foxy erythema migrans in stage Lyme disease cell. Equals 59 A tet LOL bole foci. Localization, left torso, primary lesion, circular erythema with central clearing around the tick bite site. Diagnosis, erythema migrans. Source, copyright IMPP. Erythema chronicum migrans in Lyme disease OSC. Localization, left chest, supramammillary, and axilla lesion, erythema description, prominent rim of sharply margin at erythema, annular reddening within the right border, no pain or itching. Diagnosis, erythema chronicum migrans in Lyme disease. Source, copyright IMPP. Target lesion in erythema with scaling ERZOSAES8, 1S Lee 7 Rees no greater love than Jesus, there's no greater love than he gives. Left torso of a patient. Around, erythematous skin lesion with discrete central scaling and typical target shape appearance is seen. These findings are highly suggestive of erythema chronicum migrans in Lyme disease. Source, copyright IMPP. Erythema chronicum migrans in stage Lyme disease. Source, copyright IMPP. BM. Cello AKSE. Fours as there's no greater love that frees us so deep within. SRA as BA, equals ni there's no greater love that frees us so deep within, erythema chronicum migrans in stage Lyme disease VV. Source, copyright IMPP. Euro Lyme disease, 10/11. GSRSAS, 2ES equals oh there's no greater love than Jesus, there's no greater love than he gives. Borrelial lymphocytoma. Localization, right ear lesion, nodule description, and asymptomatic, 1x 0.5 cm large, blue-reddish swelling on the right ear lobe. Suspected diagnosis, borrelial lymphocytoma, also referred to as cutaneous lymphoid hyperplasia or lymphadenosis cutis benigna. Special remark, findings specific to European Lyme disease. Source, copyright IMPP. Fibrous nodule in patient with acrodermatitis chronica atropicans OAC equals LEES4I there's no greater love than Jesus, there's no greater love than he gives. This patient has a characteristic blue-reddish nodule over the elbow, which is a typical site for acrodermatitis chronica atropicans. The patient is likely to show tenderness on palpation and a polyneuropathy of the area. This chronic progressive skin atrophy is mainly found in Europe. Source, copyright IMPP. Confirmed or possible tick bite. Development of erythema migrans. Yes no V. Symptoms of disseminated Lyme yes disease. No V. Two-step testing 1. ELISA L2. Western blot / positive negative VVVV. Antibiotic treatment. Consider other Lyme disease causes unlikely. Diagnosis of Lyme disease VV. Copyright Boss. 7. Asia, still nay I am we praise your name stand in awe of erythema migrans in stage I Lyme disease your never-ending love. A large, primary lesion with circular erythema and central clearing on the posterior side of the right upper arm is visible. This clinical picture is typical of erythema migrans, stage Lyme disease. Illustration, bullseye sign. Source, ID # 9875, CDC/James Gaffney, Centers for Disease Control and Prevention, CDC, licensed under public domain. Erythema migrans OIC head equals NE2EST love. So great, that it covers adlamy sin and shame. A round, homogeneous area of erythema with a diameter of approximate 14 cm can be seen on the right shoulder of this patient diagnosed with Lyme disease. The circular expanding lesion forming around a tick bite is highly suggestive of erythema migrans, which is characteristic of Lyme disease. Source: ID #14482, Centers for Disease Control and Prevention, licensed under public domain. AASSS 3 at SME SOT. Erythema migrans, no greater power, there is no greater force in all the earth. A circular erythematous rash with a central clearing, bullseye rash, is visible on the upper back. Erythema migrans is typically seen in the early localized stage of Lyme disease. Source: courtesy of Dr. Gary M. White, MD. Erythema migrans in stage I Lyme disease, August 7 al. Then the strength of his love localization, posterior side of left upper arm, lesion, oval-shaped, expanding erythema with central clearing. Red tick bite in the center of the erythema. Source: copyright IMPP. Erythema migrans in stage Lyme disease. Localization: left torso, primary lesion, circular erythema with central clearing around the tick bite site. Diagnosis: erythema migrans. Source: copyright IMPP. Erythema chronicum migrans in Lyme disease. Localization: left chest, supramammillary, and axilla lesion, erythema. Description: prominent rim of sharply margin at erythema, annular reddening within the right border, no pain or itching. Diagnosis: erythema chronicum migrans in Lyme disease. Source: copyright IMPP. Target lesion in erythema with scaling Asia. Zlal has as we praise your name stand in / of left torso of a patient YBUR never ending love around, erythematous skin lesion with discrete central scaling and typical target shape appearance is seen. These findings are highly suggestive of erythema chronicum migrans in Lyme disease. Source: copyright IMPP. WG. Icephone, SELOL Bake, aft. Erythema chronicum migrans in stage Lyme disease VV. Source: copyright IMPP. Erythema chronicum migrans in stage Lyme disease VV. Source: copyright IMPP. AMSB equals S20, HASCT sorrel fibrous nodule in patient with acrodermatitis chronica atropicans. No greater power, there is no greater force in Beck the earth. This patient has a characteristic blue-reddish nodule over the elbow, which is a typical site for acrodermatitis chronica atropicans. The patient is likely to show tenderness on palpation and a polyneuropathy of the area. This chronic progressive skin atrophy is mainly found in Europe. Source: copyright IMPP. Lyme disease Borrelia burgdorferi. S. Various tick species, mainly Ixodes scapularis, vector, stage I, 7 to 14 days, stage IL, 3 to 10 weeks incubation period, stage IL, months to years. Stage I, early localized Lyme disease, erythema chronicum migrans. Stage IL, early disseminated Lyme disease. Clinical features: migratory arthralgia, Bell's palsy, myocarditis. Stage IL, late Lyme disease, chronic arthritis, progressive encephalomyelitis. AL 7.2 cases per 100,000 U.S. population, 2018, annual incidence. Avoid endemic areas and exposure plus, instant tick removal prevention, protective clothing, tick repellents. At most commonly reported vector-borne disease NC in the U.S. Yote areas endemic for Lyme disease. IB highly endemic, J suspected, B moderately endemic _ not endemic. O3 just tab. Then the strength of his love. Lyme disease fact sheet and U.S. endemicity map VV. Map based on data from the Centers for Disease Control and Prevention, 2015. Copyright Boss. And Lyme disease, 2 halves. Lyme disease Borrelia burgdorferi sensulato. Transmission. Incubation period. Clinical features. Annual incidence. Prevention. Note. Species of Ixodes genus. Early localized infection, stage days to weeks, early disseminated infection, stage 2 weeks to months, late disseminated infection, stage 3 months to years. Stage erythema migrans cutaneous lymphoid hyperplasia stage 2 acute neuroborreliosis, Lyme carditis stage ill Lyme arthritis, acrodermatitis chronica atropicans, chronic neuroborreliosis. Differs depending on region, U.S., 30,000 cases. Post-exposure prophylaxis, tick removal, observed tick bite site no vaccine available. Ticks are also vectors for other pathogens, e.g., tick-borne encephalitis virus. Y distribution of Lyme disease and its vectors. BB Ixodes ricinus, castor bean tick, I. Ixodes scapularis, deer tick, Ixodes persulcatus, taiga tick, Ixodes pacificus, western black-legged tick, I. Ixodes ricinus, castor bean tick, and Ixodes persulcatus, taiga tick. GSS chel equals 8, 4 plus 32 full. There's no greater love than Jesus, there's no greater love than he gives. Global distribution of Lyme disease and its vectors. Copyright Boss. Data from Steer et al., doi 10.1038/NRDP.2016.90. X. Helminth infections. Helminths, i.e., parasitic worms, are a group of macroparasites encompassing a variety of species that can infect their hosts in 3 different ways: ingestion of eggs or larvae, example via contaminated food and water or fecal oral route, direct penetration of the skin, and via the bite of vectors, example certain species of flies and mosquitoes. Helminths are classified based on their macroscopic appearance as nematodes, i.e., roundworms. Genera include Toxocara, Enterobius, Trichuris, Ascaris, Trichinella, Strongyloides, Ancylostoma, Necator, Cestodes, i.e. tapeworms. Genera include Tenia, Diphyllobothrium, Echinococcus, or Trematodes, i.e. flukes. Genera include Schistosoma, Metarchies, Facila. Most helminth species colonize the gastrointestinal tract of their hosts, provoking symptoms such as abdominal pain, nausea, and diarrhea. The larvae of certain helminth species, such as those of the Ascaris and Ancylostoma genus, migrate from the intestines via the portal vein to the lungs, potentially causing asthma-like symptoms, example dry cough, wheezing. Other species, such as Tenia solium, are capable of colonizing other human tissue, such as the brain or the liver, which can lead to life-threatening complications, example neurocysticercosis. Diagnosis of helminth infection is made primarily via evidence of eosinophilia in the blood and direct detection of worms, eggs, or larvae in stool samples. Serum IgE levels are often elevated. Treatment consists of anthelmintic agents, such as albendazole or praziquantel. For helminth infection prevention, see food and water safety. Echinococcus and schistosomiasis are discussed in separate articles. W.A. Re. Exo. Nematodes, roundworms. Nematodes, roundworms, are long, thin, unsegmented, tube-like worms with a longitudinal digestive tract opening at both ends. Adult worms form separate sexes, with the males usually being smaller than the females. Phylarly all nematodes are thread-like nematodes. They are transmitted by arthropod vectors. Nematodes, roundworms, disease pathogen mode of transmission clinical features diagnosis treatment. Pulmonary symptoms OE dry cough O wheezing ** degree Loeffler syndrome * oval, knobby eggs in stool ascariasis A. Equals * bendazoles lumbricoides * GL symptoms scent eosinophilia. Plus enterobius. Copyright abdominal discomfort O nausea copyright intestinal or bile duct obstruction. Anal pruritus * parental pamode or enterobiasis, pinworm * tape test, vermicularis * vulvovaginitis 2 bendazoles. Trichuris fecal oral. Trichuriasis, whipworm, FERIURE rectal prolapse in children * eggs in stool scent bendazoles. Toxocaricanus toxocariasis toxocaricati. Trichinellosis aspiralis. Ancylostoma. Consumption of undercooked meat, pork, plus fecal oral, rare. Visceral toxocariasis copyright fever copyright rash organ-specific symptoms, example hepatosplenomegaly, Loeffler syndrome, myocarditis, seizures. Degree. Ocular toxocariasis copyright unilateral vision loss degree strabismus e leukocoria. Intestinal phase copyright abdominal pain degree diarrhea degree nausea, vomiting muscle phase copyright myositis e periorbital edema. Cutaneous symptoms. Degree erythema copyright pruritus e cutaneous larva migrans pulmonary symptoms. ELISA, IgG antibodies against Toxocara excretory/secretory antigens eosinophilia. Serology, IgG antibodies against Trichinella scent eosinophilia. Scent bendazoles. H. Ancel EET duodenal copyright dry cough * eggs or worms in stool parental pamote or nicatariasis, Nicator copyright wheezing * eosinophilia bendazoles americanus degree Loeffler syndrome. Scent penetration of the skin by a larvae. GI symptoms OE abdominal pain e nausea anemia. Cutaneous symptoms. Erythema e pruritus degree cutaneous larva migrans pulmonary symptoms SRA * strongyloides copyright dry cough * mobile larvae in stool * ivermectin or back collapse fine text outline. Scent penetration of the sober skin by a larvae cutaneous symptoms degree erythema degree pruritus e cutaneous larva migrans pulmonary symptoms AE scent strongyloides copyright dry cough scent mobile larvae in stool * ivermectin or strongyloidiasis 7-2, stercoralis degree wheezing scent eosinophilia bendazoles copyright hemoptysis copyright Loeffler syndrome GI symptoms OE abdominal pain degree nausea. Mostly asymptomatic calabar swellings bite of mango fly, ocular symptoms * blood smear, loiosis plus loalo, equals * diethylcarbamazine deer fly, or horse fly copyright congestion scent eosinophilia copyright pruritus copyright pain. Ocular symptoms copyright uveitis copyright keratitis copyright optic atrophy degree blindness dermal symptoms filariasis scent skin snip equals * onchocerca 4% pruritus * Mazzati test 7 onchocerciasis plus female blackfly bite copyright depigmentation, I * ivermectin volvulus * slit lamp examination copyright skin atrophy * serology copyright subcutaneous nodules copyright hyperpigmented papules systemic symptoms degree weight loss musculoskeletal pain copyright allergic reactions. Lymphadenopathy T. lymphatic * Wuchereria * female mosquito scent blood smear * diethylcarbamazine F equals swelling of lower extremities filariasis Bancroft T bite * serology * ivermectin hydrocele. And eating a toxic treat, Toxocara, Trichinella, Enterobius, Ascaris, and Trichiurus are transmitted by ingestion. QB sand on your shins, ankles, and neck, strongyloides, ancylostoma, and Nicator penetrate the skin while walking on sand. B and the owl bites, Onchocerca, Loa, and Wuchereria are transmitted by bites. WZ. CES. Ascariasis. Pathogen. O. Ascaris lumbricoides, giant roundworm, copyright Ascaris are nematodes. I. Epidemiology, most common helminth infection worldwide, mainly affects children in tropical countries with low standards of hygiene. Mode of transmission, fecal-oral, infection occurs in the larval state following the consumption of contaminated food, especially raw vegetables that have been contaminated by human waste used as a fertilizer. Life cycle, Host ingests eggs, eggs hatch and release larvae. Larvae invade intestinal walls. Larvae migrate to lungs via portal vein. Larvae migrate into alveoli, trachea, tracheal migration, and larynx. Larvae are expectorated into the mouth and swallowed back into the intestine. Larvae return to the intestine. Larvae mature into adult worms, which then lay new eggs. Clinical features. Most patients are asymptomatic. Early symptoms. Dry cough, blood-tinged sputum, wheezing. Loeffler syndrome, a transient respiratory disorder characterized by accumulation of eosinophils in the lungs due to certain infections, usually parasites, or allergic reactions to drugs. Symptoms are usually mild and resolve spontaneously. Late symptoms, anorexia, abdominal discomfort, nausea, vomiting, and diarrhea. Additional symptoms due to blockage by adult worms depend on the location of the obstruction. Bowel obstruction, especially at ileocecal valve, may lead to intestinal perforation. Obstruction of the appendix. Features of appendicitis. Obstruction of biliary and pancreatic ducts. Features of cholestasis, pancreatitis. Scent diagnosis. Back collapse. Fine text outline. Scent diagnosis. Copyright CBC shows eosinophilia. Copyright confirmatory test. Stool samples show the presence of worms or visible oval eggs with a knobby appearance under the microscope. Scent treatment. Copyright treatment of choice, bendazoles. Copyright during pregnancy, parental pamode. Enterobiasis. Pathogen Enterobius vermicularis, pinworm. Copyright pinworms are nematodes. Plus epidemiology 2, most common helminthic infection in the U.S. Prevalence in the U.S., 12%. Copyright primarily affects children 5 to 10 years of age. Scent mode of transmission. Initial infection, fecal oral. Copyright reinfection, digital oral after scratching. Anal region. Scent clinical features. Copyright anal pruritus, especially at night. Copyright vulvovaginitis, especially in children. Copyright occasionally. Symptoms of intestinal infection, i.e., nausea, vomiting, and abdominal pain which may become severe enough to mimic appendicitis. Scent diagnosis. Copyright tape test, microscopic. Detection of oval eggs, ova, and or pinworms on tape that has been pressed against the perianal region. Copyright can be an incidental finding on endoscopy plus treatment, bendazoles or parental pamode, IL-4. Copyright during pregnancy. Parental pamode is the drug of choice. Should only be administered if pregnancy is compromised. Example: weight loss, sleeplessness. Should not be started until the 34th trimester, after which the risk to fetus is likely to be low. Copyright enterobius commonly manifests with perianal pruritus. Degree SPH Fa. DS Met EEPRD Slencatum Love ERNCS So Deep /within. Trichiuriasis. Scent pathogen. Copyright Trichuris trichiura, whipworm. Whipworms are nematodes. Scent mode of transmission, fecal oral life cycle. Host ingests eggs, eggs hatch and release larvae in the small intestine. Larvae mature into adult worms in colon. Adult worms lay eggs, which are shed in feces. Scent clinical features. Mostly asymptomatic. Copyright in children. Severe infection causes diarrhea, iron deficiency, anemia, growth retardation, rectal prolapse. Scent diagnosis. Copyright microscopic examination of stool for eggs. Copyright concentration technique can be used for light infections. Scent treatment, mebendazole or albendazole. Back collapse. Fine text outline. WA. Olo. Toxocariasis. Pathogen Toxocara canis, dog roundworm, Toxocara mystax /Toxocara cauti, cat roundworm. Copyright Toxocara are nematodes. Scent mode of transmission, fecal oral, ingestion of Toxocara eggs from an infected dog or cat feces, example in contaminated playground sand or garden soil. 5 Scent incubation period, 2 to 4 weeks. Scent clinical features. Visceral toxocariasis, also called visceral larva migrans caused by larvae migrating through the intestinal wall into the blood and reaching other organs equals fever and flu-like symptoms equals additional symptoms depend on the affected organs equals liver, hepatomegaly and abdominal pain equals lungs equals dyspnea, wheezing, cough, pneumonia Lurler syndrome equals skin, rash equals heart, myocarditis equals CNS, also called neural larva migrans seizures, coma o ocular toxocariasis, also called ocular larva migrans caused by larvae migrating into the eye unilateral impairment or loss of vision and resulting strabismus equals leukocoria. Inflammation, scarring, and possible detachment of the retina. Scent diagnosis o initial tests equals complete blood cell, CBC, count, eosinophilia TF serum total IgE confirmatory test, ELISA detects IgG antibodies to toxocara excretory/secretory antigen scent treatment, bendazoles. Leishmaniasis. Pathogen _ number 8 SSCAS MET IFESRUL copyright Trichinella spiralis and other Trichinella species. There's no greater love than Jesus, there's no greater love than he gives. Copyright Trichinella are nematodes. Scent mode of transmission o consumption of undercooked meat, especially pork, containing instead larvae o fecal oral, rarely. Scent life cycle, host ingests meat that contains cysts. Larvae invade the small bowel mucosa. Larvae develop into adult worms. Adult worms release larvae, which then migrate to muscles, where they encyst. Plus incubation period, 7 to 30 days, 4 scent clinical features. Copyright intestinal phase, abdominal pain, diarrhea, nausea, and vomiting. O muscle phase equals myositis, myalgia, muscle swelling, weakness equals periorbital edema equals other symptoms include, fever, rash, splinter hemorrhages, retinal and conjunctival hemorrhages, chemosis. Scent diagnosis OCBC shows eosinophilia, and sometimes leukocytosis. Copyright confirmatory test, serological detection of antibodies. Back collapse fine text outline. Scent diagnosis copyright CBC shows eosinophilia, and sometimes leukocytosis. Copyright confirmatory test, serological detection of antibodies. Degree 1 creatine kinase o rarely muscle biopsy. Scent treatment, bendazoles. Copyright in mild cases, the infection is self-limiting and analgesic therapy suffices. OE antihelminthics are only indicated in more serious cases with systemic manifestations. Scent complications. Copyright cardiac, ECG changes, example arrhythmias, OCNS, meningitis, encephalitis. Copulmonary, myositis involving respiratory muscles, pneumonia. Copyright consider Trichinella infection in patients with myositis, periorbital edema, and eosinophilia. Lee hookworm infections, ancylostomyiasis, necatariasis. Plus pathogen 71O human hookworms, Ancylostoma duodenal and Necatera americanus. Copyright zoonotic hookworms, i.e., cat and dog hookworms, Ancylostoma brasiliensis and Ancylostoma caninum, can also infect humans. O hookworms are nematodes. Mode of transmission, percutaneous penetration of larvae, primarily via the feet e.g., while walking on a beach. Scent life cycle O human hookworm, soil is contaminated with human feces containing hookworm eggs. Eggs hatch and release larvae. Larvae penetrate skin, usually the feet. Larvae migrate to lungs via blood and lymphatic vessels. Larvae migrate via bronchi and trachea to the larynx. Larvae are expectorated and swallowed back into the intestine. Larvae mature into adult worms that colonize the intestinal tract. Female hookworms lay eggs in the intestine. Eggs are eliminated with the feces. Copyright zoonotic hookworms are usually unable to break through the basement membrane after entering the human epidermis. Humans are accidental intermediate hosts, migration through the epidermis for several weeks. Scent clinical features OE cutaneous symptoms equals at entry site, pruritus, erythema, maculopapular rash equals cutaneous larva migrans, CLM serpiginous marks, cutaneous lesion with a progressive, creeping, snake-like border, representing larval tracts. Copyright in zoonotic hookworm infections, only cutaneous symptoms are present. O. Respiratory tract, dry cough, wheezing, Loeffler syndrome. Copyright intestine, abdominal pain, weight loss, nausea, vomiting, diarrhea. O. Microcytic anemia, hookworms ingest blood from the intestinal wall. Scent diagnosis. Copyright initial test, CBC may show eosinophilia and microcytic anemia. Copyright confirmatory test, stool examination for eggs or worm scent treatment. O for human hookworms, bendazoles or pyrantel pamode. O for CLM, bendazoles or ivermectin. Copyright consider hookworm infection in patients who present with a history of recent travel to a tropical country and microcytic anemia. 4.7. OES. Strongyloidiasis. Pathogen. Back collapse. Find text outline. Strongyloidiasis. Scent pathogen. Copyright Strongyloides stercoralis, threadworm. Copyright threadworms are nematodes. Mode of transmission, percutaneous penetration of larvae, primarily via the feet. A scent life cycle. 8. Copyright the Strongyloides eggs hatch in the human intestine and release larvae. Larvae are excreted with the feces and contaminate the soil. Larvae penetrate the intact skin of the definitive host. Upon contact with contaminated soil, larvae migrate to the lungs via the bloodstream. Larvae migrate to the pharynx via the alveoli and bronchial system. Larvae are swallowed, causing autoinfection. Larvae mature into adult, egg-producing worms in the intestine. Eggs develop into infectious larvae and are excreted in feces. O. Hyperinfection, some larvae may penetrate the intestinal wall and enter the bloodstream, rare. Plus incubation period, 1 to 4 weeks. Clinical features, 1. O. Cutaneous phase equals swelling, erythema, maculopapular rash equals serpiginous lesions or urticarial tracts. Larvicurans is pathognomonic, M equals pruritus. O. Pulmonary phase, dry cough and wheezing, hemoptysis, rarely pneumonia, Loeffler syndrome. O. Intestinal phase, inflammation, example duodenitis, abdominal pain equals diarrhea equals anorexia, nausea, vomiting. Scent complications. O. Hyperinfection syndrome may lead to organ dysfunction and septic shock and occurs especially in immunosuppressed individuals. Example steroid therapy, HTLV1 co-infection, AIDS. 4. Copyright meningitis. Scent diagnosis. Copyright initial test, CBC may show eosinophilia. Copyright confirmatory test, consecutive stool examination for mobile rhabditiform larvae. Scent treatment, ivermectin or bendazoles. As Liloiasis. Pathogen, Loa, a filarial nematode, 1L191. Mode of transmission, bite from chrysops, deerfly, horsefly, mango fly. Life cycle, introduction of larvae into bite wound. Larvae mature into adult worms. Adult worms reside in subcutaneous tissue, migrating through the body and causing symptoms. Adult worms produce microfilariae and release them into the bloodstream, where they are ingested by a female fly during a blood meal. Microfilariae mature into larvae, thus completing the cycle. A. Incubation period, 3 to 5 months. Clinical features. O. Most infected individuals are asymptomatic. Copyright the 2 cardinal manifestations are, equals calabar swelling, transient, localized swellings found commonly on the arms, legs, and around joints, which can cause pruritus and local pain. Pruritus, and pain. Diagnosis. Copyright initial test, CBC may show eosinophilia. Copyright confirmatory tests equals blood smear, detection of microfilariae equals visualization of adult worms in subcutaneous tissue or conjunctiva equals serology. Treatment, diethylcarbamazine. Complications. E. Encephalitis. O. Cardiomyopathy. O. Nephropathy. Copyright arthritis. E. Lymphadenitis. O. E. Solo. AI equals A, B equals A. TET. APAC. OOCE. Onchocerciasis. Pathogen, Onchocerca volvulus _ degree 211. Mode of transmission, bite of the female blackfly. Life cycle, Host is bitten by blackfly larvae are introduced into bite wound larvae mature into adult worms that reside in subcutaneous or intramuscular tissue. Adult worms produce microfilariae. Microfilariae migrate through subcutaneous tissue, causing clinical symptoms. Female fly consumes microfilariae during a blood meal. Microfilariae mature into larvae, thus, completing the cycle. Clinical features. Copyright ocular onchocerciasis equals keratitis equals uveitis equals optic atrophy equals onchochorioretinitis equals ocular lesions can progress to blindness, hence the common name river blindness. Copyright onchocercal skin disease onchocercomata, subcutaneous nodules. Deep, non-palpable nodules containing adult worms that are found over various bony prominences. Generalized pruritic lesions. Hyperpigmented papules, Sauda, skin atrophy, due to loss of skin elasticity, hanging groin. Depigmentation, leopard skin appearance. Systemic manifestations equals allergic reactions to microfilariae may occur equals weight loss equals generalized musculoskeletal complaints, example back and joint pain, equals inguinal and femoral hernia. Scent diagnosis degree. Skin snips. Gold standard superficial skin biopsies are taken from an inflamed area and are incubated in saline, causing microfilariae to leave the skin sample. Microfilarial load can be determined microscopically. Equals at least 2 specimens are sampled and examined for motile microfilariae. Equals specimens of subcutaneous nodules can also be sampled and examined for adult worms. Copyright slit lamp examination. Investigation of choice for ocular onchocerciasis. Omatzati test, a provocative test that involves administering diethylcarbamazine, DEC, to induce microfilarial death and exacerbate symptoms. A positive test is highly suggestive of onchocerciasis. Serology, an unreliable means of diagnosis as it cannot distinguish between active and past infection. Scent treatment, ivermectin. Everything turns black in onchocerciasis, black flies, black skin nodules, black vision, blindness. BS treat river blindness with IV ivermectin. WA. CE. Lymphatic filariasis. Pathogens. Wuchereria bancrofti, a nematode, responsible for most cases of lymphatic filariasis worldwide. Brugia malayi and Brugia timori, found in Asia. Scent mode of transmission, female mosquito bite, Aedes, Mansonia, Anopheles, and Culex. Scent incubation period, 9 to 12 months. Scent life cycle, mosquito introduces filarial larvae into host via bite wound. Larvae mature into adult worms that reside in the lymphatic system. Adult worms produce microfilariae, the blood circulating stage of filariasis causing roundworms. Microfilariae move throughout vascular and lymphatic system. Microfilariae are consumed by a female mosquito during a blood meal. Microfilariae mature into larvae, thus completing the cycle. Scent clinical features. Fever. Painful lymphadenopathy, due to worms invading lymph nodes, causing inflammation and retrograde lymphangitis. Lymphedemia with disfiguration of the lower extremities, elephantiasis. Back collapse. Fine text outline. Hydrocele. Scent diagnosis. Copyright blood smear obtained at night, and staining with Giemsa or hematoxylin and eosin. Detection of microfilariae. Copyright serology, elevated levels of antifilarial LGG4. Scent treatment. Copyright diethyliarbamazine, DEC drug of choice. Copyright ivermectin, used in areas where onchocerciasis is prevalent, as DEC can worsen onchocercal eye disease. Copyright elevation of the affected extremity, exercise, and wearing therapeutic shoes, recommended for those with lymphedemia. Surgery for hydrocele. Cestodes, tapeworms. Cestodes, tapeworms, are long, flat, ribbon-like worms composed of numerous segments and a single scolex at the head with which they anchor themselves to the intestine. Since they do not have a digestive tract, all nutrients are absorbed through the tegument. Cestodes are hermaphroditic, they contain both male and female organs. Overview of cystode infections. Disease pathogen, mode of transmission, clinical features, diagnosis, treatment. Scent mostly asymptomatic. Scent Tenia saginata, beef GL. Symptoms intestinal tapeworm, scent consumption of Z, scent eggs or proglottids in stool pair. Stewards Teniasis. Scent Tenia solium, pork undercooked beef or pork. Degree S. Rhamnelopathy. Scent eosinophilia OE. Nausea, tapeworm, equals vomiting. Degree weight loss. Scent neurological symptoms, Teniasis. Copyright scent intracranial * cerebral MRI/CT, cystic lesions. Pressure radiography may show characteristic rice. Degree neurological grain appearance, 21 * neurocysticercosis. Scent Tenia solium, pork deficits * EITB. Copyright albendazole plus cysticercosis. Scent fecal oral, tapeworm, degree seizures. Scent CSF analysis. Copyright corticosteroids. Scent ocular symptoms. Copyright 7. Protein * alternatively, praziquantel. Copyright pain. Degree J. Glucose. Copyright loss of visual. E. Mononuclear pleocytosis. Acuity. Degree loss of vision. Mostly 001. Scent consumption of raw or scent eggs or proglottids in stool. Scent Diphyllobothrium latum. Asymptomatic. Diphyllobothriasis undercooked fresh water. Scent eosinophilia. Scent praziquantel, fish tapeworm, scent vitamin B2 fish equals scent megaloblastic anemia deficiency. Scent GL symptoms. Scent fecal oral nausea, and scent ELISA. Scent albendazole. Echinococcus. Scent hoofed animals, example. Degree vomiting. Echinococcus equals Z, SS *CT/MRI. Scent surgical removal of cysts. Granulosis. Sheep, R. Intermediate. E. Abdominal pain. Scent eggshell calcifications within hydatides. Cyst percutaneous aspiration. Hosts * anaphylaxis with cyst rupture. Scent mostly asymptomatic. Hymenolpes nana 4b, *GI symptoms. Praziquantel, dwarf tapeworm, ingestion of eggs or, Hymenolpus ena. Anorexia * eggs in stool. Scent alternatively, niclosamide. Hymenolpes diminutus cysticercoids, S. E. abdominal pain or nitazoxanide, rat tapeworm, 7. Copyright diarrhea. Scent headache. O. CES. O. Teniasis. Intestinal Teniasis. Cysticercosis 13. An intestinal infection with adult tapeworms that causes mainly GI. Scent a tissue infection with tapeworm larvae. Symptoms depend on the infected organ, example description. LS symptoms: muscles, brain, skin. Tenia saginata, beef tapeworm. 4. Pathogen Tenia solium, pork tapeworm, Tenia solium, pork tapeworm. Mode of transmission: ingestion of larvae, cysticerci, in raw or undercooked beef/pork. Scent fecal oral, eggs are ingested from contaminated water or vegetables. Life cycle: eggs hatch in the human intestine, develop into adult worms, produce proglottids which can detach from the tapeworm and are passed in the feces. Often asymptomatic. Symptoms caused by cysticerci: accumulation in subcutaneous tissue, muscles, brain, spinal cord, and eyes. Often asymptomatic. Symptoms caused by adult worms in the intestinal tract: abdominal pain, anorexia, weight loss, nausea, and vomiting. Palpable subcutaneous cysts. Degree O. myalgia. Copyright neurocysticercosis, cysticerci containing cysts in the CNS. Increased intracranial pressure, neurological deficits, seizures. Copyright ocular cysticercosis, eye pain, loss of visual acuity or vision in one eye. Clinical features. Initial test, CBC may show eosinophilia. Additional testing. Copyright imaging, cerebral MRI/CT showing multiple, small. 71. Scent praziquantel. Degree F, scent for neurocysticercosis, plus corti. Avoid raw pork and inspect for cysticerci, plus adequately freeze and cook meat to destroy viable cysticerci. Prevention * dispose of human feces properly * hand washing before meal preparation. Copyright cysticercosis can cause brain cysts and seizures. Lee diphyllobothriasis, Diphyllobothrium latum or fish tapeworm infection. Asterisk pathogen, 4. O. Diphyllobothrium latum, fish tapeworm. O. Fish tapeworms are cestodes. Scent mode of transmission, consumption of raw or undercooked freshwater fish containing larvae. Scent life cycle, larvae develop into adult tapeworms in the small intestine. Adult worms produce proglottids, which can detach from the tapeworm and are passed in the feces. Scent clinical features. O. Usually asymptomatic. Copyright chronic infection leads to vitamin B deficiency. Fish tapeworms compete with the host for dietary vitamin B12 in the intestine. Anemia and/or neurological symptoms. Scent diagnosis. O. Initial test, CBC may show eosinophilia and megaloblastic anemia. Copyright confirmatory test, stool examination for eggs or proglottids, i.e., segments of adult tapeworms. Scent treatment, praziquantel. At, Diphyllobothrium causes vitamin B12 deficiency. Back collapse. Fine text outline. Hymenolpiasis. Pathogen, Hymenolpes nana, dwarf tapeworm, 15. Mode of transmission. Copyright ingestion of eggs from contaminated food or water. Degree ingestion of cysticercoids from infected arthropods. Life cycle, ingestion of eggs develop into cysticercoid larvae in the small intestine villus. Alternatively, cysticercoids can be consumed from infected arthropods. Cysticercoids, released upon rupture of the intestinal villus, develop into an adult worm in the intestinal lumen. Eggs are passed through the stool. Clinical features. Copyright mostly asymptomatic. O. Severe infection with Hymenolpes nana. Presence with equals anorexia, abdominal pain, diarrhea equals weakness, headache. Diagnosis, stool examination for eggs. Treatment. Copyright praziquantel. Copyright niclosamide or nitazoxanide. Trematodes, flukes. Trematodes, flukes, are small, flat, oval worms with two suckers, one located at the mouth and the other ventrally, and a blind-ending gut. Most species are hermaphroditic, but some also form separate male and female adults. Overview of trematode infections. Disease. Pathogen. Mode of transmission. Clinical features. Diagnosis. Treatment. Pruritic maculopapular rash, swimmer's itch, goo. Symptoms. O. Hematuria eodyssuria asterisk schistosoma. Degree can cause bladder carcinoma. Manzoni. Asterisk penetration of the skin by a larvae. Asterisk GL. Symptoms. Scent eggs in stool or urine. 2. Asterisk schistosoma, equals scent praziquantel. Schistosomiasis, freshwater snails are intermediate. Copyright diarrhea. Asterisk serology. Hematobium equals asterisk corticosteroids. Hosts. Copyright abdominal pain. Asterisk eosinophilia. Schistosoma. Copyright hepatosplenomegaly. Copyright periportal fibrosis and portal hypertension. Japonicum. Pulmonary symptoms. Pulmonary hypertension. Copyright cor pulmonale. Mostly asymptomatic. cholangitis, cholelithiasis. GI symptoms, eggs in stool. Asterisk consumption of raw/undercooked. Clonorchiasis. Asterisk clonorchiasis. Copyright ruq abdominal pain. Scent eosinophilia. Scent praziquantel. Freshwater fish. Copyright diarrhea. 7. Colonase, alkaline phosphatase. jaundice. Increased risk of cholangiocarcinoma. Mostly asymptomatic. Possibly prodromal. GI symptoms. Paragonimus westermanni. Scent pulmonary form. Asterisk Paragonimus mexicanus. Asterisk consumption of raw/undercooked. Copyright mild fever, night sweat. Scent eggs in sputum or stool. Pre-anarital. Asterisk Paragonimus seafood. Copyright productive cough, hemoptysis. Asterisk eosinophilia equals L. aragonimisias. F. Asterisk triclobendazole _Kelikoti. Asterisk utilization of contaminated. Degree plural effusions plus Elisa Surreacel Simuval Paragonimus cooking utensils. Scent extrapulmonary form. Asterisk chest x-ray. IU heterotremus. Copyright possibly cysts, abscess, and/or asterisk Paragonimus granuloma formation. Africanus. Copyright cerebral paragonimiasis. Asterisk acute phase. Copyright fever, copyright right upper quadrant pain, asterisk eggs in stool, degree hepatomegaly, asterisk ELISA, asterisk triclobendazole 00, asterisk fasciole hepatica, asterisk consumption of contaminated fascioliasis, asterisk chronic biliary phase, asterisk eosinophilia plus ERCP in case of biliary, asterisk fasciola gigantica, Irschwatten plants plus endoscopy, adult flukes in obstruction, copyright abdominal pain o nausea, vomiting, copyright diarrhea e common bile duct obstruction. The biliary tract. Back collapse, fine text outline. OC clonorchiasis. Scent pathogen, copyright Clonorchis sinensis, Chinese liver fluke, copyright Clonorchis are trematodes, flukes. O endemic to certain parts of Asia, mode of transmission, consumption of raw/undercooked freshwater fish, 16 incubation period, 10 to 26 days life cycle, water is contaminated with human feces containing Clonorchis eggs. Eggs are ingested by freshwater snails and mature into larvae. Larvae are released to water and penetrate fish, plus humans eat fish containing larvae. Larvae migrate to biliary tract and mature into adult worms. Asterisk eggs of adult worms are released into the bile ducts and carried to the intestinal tract. Eggs are eliminated with the feces, thus completing the cycle. Clinical features. Copyright most infected individuals are asymptomatic. OE acute symptoms equals cholangitis, unspecific symptoms, example right upper quadrant pain, diarrhea, fatigue. Copyright chronic symptoms and complications equals cholelithiasis with pigmented gallstones equals hepatomegaly equals malnutrition, weight loss equals jaundice equals risk factor for cholangiocarcinomas. Scent diagnosis. Copyright microscopic examination of stool for eggs. Copyright serum studies, eosinophilia and TT alkaline phosphatase. Scent treatment, praziquantel, 17. 00/E-Fe9 cell SPW, who have gathered in the name of the Lord. Li paragonimiasis and E pathogen Co-Paragonimus westermanni, responsible for most infections, less commonly P. mexicanus, P. kellicati, P. heterotremus, P. africanus. O. paragonimus is a genus of trematodes that commonly infest the lung flukes. O. paragonimus species are endemic to Southeast Asia, Latin America, and Africa. Mode of transmission. Copyright consumption of raw/undercooked crabs, crayfish, and contaminated seaweed. Copyright utilization of contaminated cooking utensils. 18 incubation period, 2 to 16 weeks life cycle. Larvae in fresh water penetrate crabs, crayfish, and other crustaceans. Larvae exist to metalarvae. Humans consume infected crustaceans. Metalarvae exist and penetrate the intestinal wall, then migrate to the lungs. Larvae develop into adults in the lungs and eggs are expectorated with the sputum. Eggs are swallowed and eliminated with the feces, thereby reaching fresh water again. Clinical features. O. rare prodromal signs, example abdominal pain, fever, diarrhea. O. possibly asymptomatic. O. pulmonary form equals mild fever equals night sweats equals productive cough. Hemoptysis equals pleural effusions. O. extrapulmonary form equals cerebral paragonimiasis equals early symptoms resemble meningoencephalitis. Equals chronic symptoms include headache, vomiting, seizures, and weakness. Equals possibly cyst, abscess, and granuloma formation in the intestine, spleen, peritoneum, and mesenteric lymph nodes. Scent diagnosis. O. microscopic examination, detection of eggs in the sputum, feces, pleural fluid, cerebrospinal fluid, and pus. Copyright serological test equals CBC count, eosinophilia equals enzyme-linked immunosorbent assay, ELISA. Back collapse, fine text outline. Eggs are swallowed and eliminated with the feces, thereby reaching fresh water again. Scent clinical features. Copyright rare prodromal signs, example abdominal pain, fever, diarrhea. Copyright possibly asymptomatic. O. pulmonary form equals mild fever equals night sweats equals productive cough. Hemoptysis pleural effusions. Extrapulmonary form equals cerebral paragonimiasis equals early symptoms resemble meningoencephalitis. Equals chronic symptoms include headache, vomiting, seizures, and weakness equals possibly cyst, abscess, and granuloma formation in the intestine, spleen, peritoneum, and mesenteric lymph nodes. Scent diagnosis. Copyright microscopic examination, detection of eggs in the sputum, feces, pleural fluid, cerebrospinal fluid, and pus. Copyright serological test equals CBC count, eosinophilia equals enzyme-linked immunosorbent assay, ELISA. Copyright chest X-ray showing ring shadows, fibrosis, calcifications, pleural effusions, and /or pleural thickening. Scent differential diagnoses, tuberculosis. Scent complications. O. Pulmonary complications, secondary infections, bronchiectasis, lung abscess, emphysema. Copyright cerebral complications, seizures, coma. Copyright skin complications, migratory allergic skin lesions. Scent treatment. Copyright praziquantel. Degree. Copyright triclabendazole. O. Extrapulmonary lesions should be surgically excised. Scent prevention, in endemic areas, avoid eating raw or undercooked crustaceans and seaweed. WA. A6. Lephoceliasis I equals so 23's 150. Let OSSTLS equals let USC. The generation, pathogen, Facela hepatica, Facela gigantica. Congfat ERNNEAE. Scent mode of transmission. Copyright consumption of contaminated freshwater plants, example watercress. Copyright drinking contaminated freshwater. Scent life cycle. O. Metacercariae on freshwater plants are ingested by herbivorous mammals, example sheep, cattle, both definitive hosts, or humans, incidental hosts, migration of the organism through the intestinal wall. Then liver parenchyma, and into the biliary ducts. Adult fluke release eggs into the biliary ducts, which are then passed in the stool of the host. O. Snails serve as the intermediate hosts. Scent clinical features. Copyright acute phase, fever, right upper quadrant pain, and hepatomegaly. Copyright chronic biliary phase, abdominal pain, nausea, vomiting, and diarrhea. Copyright features of biliary obstruction, biliary colic, cholangitis, cholelithiasis, and obstructive jaundice. Scent diagnosis. Copyright microscopic examination, detection of eggs in the stool or bile sample. OCBC count, eosinophilia, marked in the acute phase. O. enzyme-linked immunosorbent assay, ELISA. O. endoscopy, adult flukes in the biliary tract. Scent treatment. Copyright triclabendazole. O. ERCP in case of biliary obstruction. Tips and links. Sources. Last updated December 15, 2023. Back collapse. Find text outline. 25's Ma, 25 degrees 23th. Establishing faith. Walking the path of faith. Ascaris lumbricoides, giant roundworm. A type of soil transmitted helminth, 15 centimeters long specimen. Source, copyright IMPP. Ascaris lumbricoides fertilized egg. Photomicrograph of a wet mount of human feces. A yellowish-brown, round ovum with a knobby, mammillated, outer layer is visible. This is the typical appearance of an Ascaris lumbricoides egg. The round shape indicates that it is fertilized. Source, Ascaris lumbricoides by Graham Calm, Wikimedia Commons, licensed under CC by SA 3.0. Euro_helminth infections, 3/3. Is FNTHFGEY. Ascaris lumbricoides, giant roundworm, stool sample with a 20 cm long specimen. Source, copyright IMPP Sealeoianintal. Enterobius vermicularis eggs 233 MPa, HS9, SS1H. Establishing faith. Walking the path of faith. Photomicrograph of a specimen prepared by applying cellulose tape to the anal region of a patient, very high magnification, 8 transparent, elongated oval eggs, which are flattened asymmetrically on one side, can be seen. Source, 5229, Enterobius vermicularis, CDC, Centers for Disease Control and Prevention, Atlanta, USA. Licensed under public domain. Enterobius vermicularis, pinworm. Endoscopic view of the colon. A worm is visible in the colon, green overlay. The surrounding mucosa's surface and vascular pattern appear normal. Our great thanks to Sono.Gallery, a medical ultrasound library by Dr. Daniel Merkel, for providing the images and videos. Overlay 6. SE. SAU TE2 equals EB OLS dash equals OL0 TE vermiform appendix with enterobius vermicularis AAPM 70 the will of the Achide God. Photomicrograph of a tissue biopsy specimen of the appendix, HNE stain, high magnification, enterobius vermicularis, green overlay, with hooks, red overlay, for attachment to the intestinal wall is visible within the lumen of the appendix. Click on the microscope icon to view the entire specimen through a virtual microscope. Source, copyright Smart Zoom, Smart in Media. Image and annotations in digital microscopy, PD Dr. Alberto Perez Buza. Overlay. Vermiform appendix with enterobius vermicularis says OO. HL Zora. Fist equals O Atta, we are the precious children of God. United Ash has planned photomicrograph of a tissue biopsy specimen of the appendix, HNE stain, high magnification, enterobius vermicularis, green overlay, with hooks, red overlay, for attachment to the intestinal wall is visible within the lumen of the appendix. Click on the microscope icon to view the entire specimen through a virtual microscope. Source, copyright Smart Zoom, Smart in Media. Image and annotations in digital microscopy, PD Dr. Alberto Perez Buza. Smart Zoom Viewer. 4, and Juz, age male, 224's 11H. Establishing Faith Q Walking the Path of Faith ASRR powered by Smart Zoom copyright 2023 pounds. Smart Zoom Viewer. GL tract of enterobius vermicularis. Enterobius vermicularis lives on the nutrients ingested by the host. Thuiadiop the Almighty God powered by Smart Zoom copyright 2023. Smart Zoom Viewer. Hook of enterobius vermicularis. Enterobius vermicularis uses its hooks to attach itself to the mucosa. SORFETO equals, Terra Wemi continue Jesus according to, equals Themaloth the Alm GH7Y equals God, powered by Smart Zoom copyright 2023 Fe. Smart Zoom Viewer. Piece of digested vegetable. This can be identified as vegetable matter, as the remains of the cells show a cell wall that is absent in animal matter. Arcelotildeolholos ST459 all OE are the precious children of God, united as he has planned powered by Smart Zoom copyright 2023. Smart Zoom Viewer. Enterobius vermicularis. The pinworm is a nematode and a common human intestinal parasite. Enterobiasis, or, imprecisely, oxyuriasis is the medical condition associated with the intestinal infestation. Cytosure stalet WILIMBRAISEHIM together powered by Smart Zoom copyright 2023. X Smart Zoom Viewer. Powered by Smart Zoom copyright 2023. Serosal surface of appendix. Consists of one layer of cuboidal epithelial cells and a thin lamina propria. This special epithelium is called mesothelium and is a derivative of the embryonic mesoderm. It produces a lubricant that enables equals AOOE no at OJQ, bad in a 2. C registered OSOOAR plus OOP equals SSI, no at O equals 5 degrees A at Q registered N no A registered CEOO and thus covered by serosa, visceral peritoneum. IP. Frictionless movement of the intraperitoneal organs. X Smart Zoom Viewer. Per erent AE Euro IESY FAT, ER. Lymphatic tissue of appendix. The appendix, vermiform appendix, cecal appendix, is assumed to function as a lymphatic organ. There are many lymphatic nodules in the lamina propria covered by a specialized follicular dome epithelium. SSA, 29, 2's th Establishing Faith Walking the Path of Faith Jai Copyright powered by Smart Zoom Copyright 2023 Sense IE equals E, OE Pant, Pre-of. Smart Zoom Viewer. Felway PIOALSJZ0. X serosal surface of appendix. The appendix is situated in the intraperitoneal space and thus covered by serosa, visceral peritoneum. It consists of one layer of cuboidal epithelial cells and a thin lamina propria. This special epithelium is called mesothelium and is a derivative of the embryonic degree mesoderm. It produces a lubricant that enables frictionless movement of the intraperitoneal organs. OE7. X Smart Zoom Viewer. OIFSSO, 20, MMAII0. YY. X muscularis propria. The muscularis propria is a smooth muscle consisting of an inner circular and outer longitudinal layer. In the appendix, the outer layer is continuous, whereas throughout the rest of the colon it is organized in longitudinal bands called tenucoli. Powered by Smart Zoom Copyright 2023 Smart in Media Cent. XX Smart Zoom Viewer. 4 Powered by Smart Zoom Copyright 2023 Smart in Media. EEV equals yen. Submucosa. The submucosa is a layer of loose connective tissue supporting the mucosa. It contains blood and lymphatic vessels, immune cells, as well as parasympathetic nerves and ganglia of the submucosal plexus, Meissner plexus. Smart Zoom Viewer. Idea eggs of Enterobius vermicularis X*, AI. EU Phi. Palme. This is a gravid female carrying eggs. OEFA let YN AE, Z. BOA. 7. At. Star. +6 PA IP. Copyright *BI. EE equals. X Smart Zoom Viewer. We 2 AOE RIA he, Lin. TAC 0 degree, 2%. X goblet cell. Goblet cells are light cells within the colonic epithelium, which do not stain due to their high mucus content. They produce a thick layer that covers the entire epithelium to protect it against bacteria of the gut flora. Plus AE, I at cent of phi AE *cent Y powered by Smart Zoom Copyright 2023 Smart in Media. Intestine. Stem cells from the bottom of the crypts are responsible for regeneration of the colonic epithelium. Colonic crypts are deeper than those of the small. Around once every 6 days. Crypt of epithelial layer. Powered by Smart Zoom Copyright 2023 Smart in Media. X Smart Zoom Viewer. Smart Zoom Viewer. The muscularis mucosae consists of several thin layers of smooth muscle that separate the mucosa from the submucosa and grant the mucosae its own motility. It is unique to the gastrointestinal tract and helps to microscopically differentiate it from other hollow organs. SSEBT. Arums. Powered by Smart Zoom Copyright 2023 Smart in Media I _*. Trichuris trichiura eggs VV. Photomicrograph of a wet stool mount, very high magnification, barrel-shaped, thick-walled eggs with bipolar hyaline protuberances are visible, which are characteristic of Trichuris trichiura, whipworm. Source, ID #630, Centers for Disease Control and Prevention, Centers for Disease Control and Prevention licensed under public domain. Anish EESERN eosinophilia in toxocariasis VV. Blood smear showing many erythrocytes and 3 eosinophil granulocytes, which indicates eosinophilia in toxocariasis, T equals thrombocytes, EG equals eosinophil granulocytes. Source, copyright IMPP. Trichinella spiralis. Photomicrograph of a striated muscle tissue specimen, H&E stain, low magnification, multiple encysted Trichinella spiralis larvae are visible throughout the sample. Most of the parasites are shown in cross-section, green overlay, some are visible in longitudinal section, green arrowhead. Source: Trichinella spiralis XS and LS40X.png by the M.R. Grove, Wikimedia Commons, licensed under CC by SA 4.0. Cutaneous larva migrans. Ankle of a patient with cutaneous larva migrans serpiginous marks, larval tracts, are visible here. However, in the case of a strong local inflammatory response, these marks may not be visible. Serpiginous marks together with pruritus establish the diagnosis of cutaneous larva migrans. Source: Larva migrans cutanea, whimsical, Wikimedia Commons licensed under public domain. Larvicurans. An erythematous, urticarial rash is visible on the flank of this patient with strongyloides stercoralis infestation. The diagnosis of strongyloidiasis is confirmed by strongyloides serology. Source: Figure 4, in simultaneous larva migrans and larvicurans caused by strongyloides stercoralis, a case report by L.D. Corte, M.V.S. De Silva, P.R.M. Souza, Hindawi, case reports in dermatological medicine, licensed under CC by 3.0. Loa fly stages at Phi, genus Chrysops, human stages takes a blood meal, L3 larvae enter bite__s. Migrate to head. 3 / Owens fly sperbosis/GS. A2 AAA in subcutaneous tissue, 7, L3 larvae. SSG at 11 RV copyright 1 WTS produce sheath microfilariae that are found in spinal fluid, urine, or takes a sputum, peripheral blood microfilariae shed blood meal in the lungs sheaths, pent rate, ingests microfilariae, flies mid-gut, and migrate to thoracic muscles. Life cycle of Loa. 1. Infective stage. An infected day-biting fly of the species Chrysops silacea or Chrysops dimidiata deposits L3 filarial larvae from its mouthparts onto the skin of a human, definitive host, from where they migrate to microcuts or the bite wound to enter the bloodstream. 2. The larvae develop into adults in subcutaneous tissue. 3. Diagnostic stage. The adult worms produce sheath microfilariae with diurnal periodicity, when they can be detected in the peripheral blood, at night. During the non-circulation phase, the worms can be detected in the lungs. 4. Microfilariae are ingested by a fly during a blood meal, infecting it in the process. 5. The microfilariae shed their sheaths and migrate through the intestinal wall into the fly's thoracic muscles. 6. The microfilariae develop into L1 larvae. A2 AAA in subcutaneous tissue, 7, L3 larvae. SS6, L1 larvae Q** produce sheath microphytariae that are found in spinal fluid, urine, or takes a sputum, peripheral blood microfilariae shed blood meal the lungs sheaths, pent rate, ingests microfilariae, flies mid-gut, and migrate to thoracic muscles. Life cycle of Loa. 3. Diagnostic stage. The adult worms produce sheath microfilariae with diurnal periodicity, when they can be detected in the peripheral blood, at night. During the non-circulation phase, the worms can be detected in the lungs. 4. Microfilariae are ingested by a fly during a blood meal, infecting it in the process. 5. The microfilariae shed their sheaths and migrate through the intestinal wall into the fly's thoracic muscles. 6. The microfilariae develop into L1 larvae. 7. The microfilariae develop into L3 larvae. 8. The L3 larvae migrate to the mouthparts of the fly. This image is an adaptation. Source of original image, CDC/DPDX. Original title, Loiosis. Created by, CDC/DPDX. Licensed under public domain. AOFE heals OHO BB212 3 OSLTSCHOSS equals BIANET at SDA. BRI SS DAY FEL S30. OL2TSHOTAE2TTRG517 subconjunctival Loa Loa infestation. Right eye of a 35-year-old patient. A subconjunctival, filamentous mass can be seen nasally. Conjunctival injections are also visible. This is the typical finding for a subconjunctival worm. The movement of a live worm can be observed with the slit lamp. Source: Fig 1, in Removal of Adult Subconjunctival Loa Loa amongst Urban Dwellers in Nigeria by Okonkwo On, Hassan A.O., Alara Ptetal, PLOS, licensed under CC by 4.0. Elephantiasis from lymphatic filariasis AE equals T's HCLSBS, 4 OSTTSHS. SSSI equals Britade, at byte deso. Bri SS Day FOS 240. OL2TSH stet photograph of the legs of an adult male, severe edema of the lower legs. This is likely due to an infection with tropical roundworms, lymphatic filariasis. Source: ID #373, CDC, Centers for Disease Control and Prevention, Atlanta, USA, licensed under public domain. Head of a pork tapeworm, Tenia solium. The distinct head, scolex, of a pork tapeworm. Characteristic of Tenia solium are 2 rows of hooks, which permit attachment to the host's intestinal wall. In contrast to pork tapeworms, beef tapeworms do not have hooks. Source: ID #14377, CDC/Dr. May Melvin, Centers for Disease Control and Prevention, CDC, licensed under public domain. Beef tapeworm, Tenia saginata. A mature beef tapeworm. The tapeworm can develop in the human intestine over weeks to months after raw or undercooked. Beef containing the larvae is ingested. May reach lengths of up to 25 m. Source: ID #5260, CDC, Centers for Disease Control and Prevention, CDC, licensed under public domain. Embryonate eggs ingested by human host. And registered. And eggs or gravid proglottids in feces and passed into environment. AM infective stage. 4 diagnostic stage. Tenia solium, life cycle. Tenia solium. 3. Copyright cysticerci may develop in any organ, most commonly in subcutaneous tissues, brain, and eyes. Is oncospheres hatch, penetrate intestinal wall, and circulate to musculature. Cystic urcoses. A. 2. Embryonate eggs and/or gravid proglottids ingested by normal intermediate host, swine. Oncospheres hatch, penetrate intestinal wall, and circulate to musculature. Into cysticerci. 5 humans AC tapeworm. Teniasis in meat. 4. Oncospheres develop. Acquire intestinal infection via consumption of cysticerci. Scolex. This image is an adaptation. Source of original image, CDC/DPDX. Original title, Tenia solium. Created by CDC/DPDX. Licensed under public domain. Modifications to original image, CDC/DPDX. Logo removed by request. Ring enhancing lesion in the brain. CT head, with contrast, axial plane, of a patient with neurocysticercosis. A rounded peripheral lesion in the right temporoparietal region has a hypodense center, yellow overlay, and thickened enhancing wall, red overlay. There is paralesional low attenuation edema, green overlay. These findings are typical of the colloidal vesicular stage of neurocysticercosis. Source: Figure 2, B, in Diagnosis and Treatment of Neurocysticercosis by Christina M. Coyle, Herbert B. Tunowitz, Interdisciplinary Perspectives on Infectious Diseases, licensed under CC by 3.0. C.S. Helminth Infections, 4/5. Ring-enhancing lesion in the brain. CT head, with contrast, axial plane, of a patient with neurocysticercose. A rounded peripheral lesion in the right temporoparietal region has a hypodense center, yellow overlay, and thickened enhancing wall, red overlay. There is perilesional low attenuation edema, green overlay. These findings are typical of the colloidal vesicular stage of neurocysticercosis. Source, Figure 2, B, in, Diagnosis and Treatment of Neurocysticercosis by Christina M. Coyle, Herbert B. Tunowitz, Interdisciplinary Perspectives on Infectious Diseases, licensed under CC by 3.0. Neurocysticercosis. Cranial MRI, flare sequence, a hyperintense nodule is visible along the margin of a rounded lesion, hole with dot sign, in the right frontal lobe that is iso-intense to CSF. The fluid-filled lesion, cysticercus, green overlay, is a larval cyst of the pork tapeworm, with the scolex, red overlay, seen as the hyperintense nodule. The finding is consistent with neurocysticercosis. Source, Figure 2, A, in, Diagnosis and Treatment of Neurocysticercosis by Christina M. Coyle, Herbert B. Tunowitz, Interdisciplinary Perspectives on Infectious Diseases, licensed under CC by 3.0. Neurocysticercosis. Cranial MRI, flare sequence, a hyperintense nodule is visible along the margin of a rounded lesion, hole with dot sign, in the right frontal lobe that is iso-intense to CSF. The fluid-filled lesion, cysticercus, green overlay, is a larval cyst of the pork tapeworm, with the scolex, red overlay, seen as the hyperintense nodule. The finding is consistent with neurocysticercosis. Source, Figure 2, A, in, Diagnosis and Treatment of Neurocysticercosis by Christina M. Coyle, Herbert B. Tunowitz, Interdisciplinary Perspectives on Infectious Diseases, licensed under CC by 3.0. L, 4A. A. Neurocysticercosis. Cranial MRI, flare sequence, a hyperintense nodule is visible along the margin of a rounded lesion, hole with dot sign, in the right frontal lobe that is iso-intense to CSF. The fluid-filled lesion, cysticercus, green overlay, is a larval cyst of the pork tapeworm, with the scolex, red overlay, seen as the hyperintense nodule. The finding is consistent with neurocysticercosis. Source, Figure 2, A, in, Diagnosis and Treatment of Neurocysticercosis by Christina M. Coyle, Herbert B. Tunowitz, Interdisciplinary Perspectives on Infectious Diseases, licensed under CC by 3.0. L, 4A. A. A7S47A. Clonorchis sinensis egg. Photomicrograph of a Clonorchis sinensis egg, 400x magnification, the myricydium, larval stage of C. sinensis, green overlay, is visible inside the egg. The narrow end of the egg is covered by an operculum, resembling a cap, blue overlay, which is separated from the egg when the myricydium hatches. At the opposite, opercular end, a small, comma-shaped knob, red overlay, is visible. This image is an adaptation. Source of original image, CDC. Original title, Phil ID #896. Created by, Melvin M. Licensed under public domain. Modifications to original image, cropped. Clonorchis sinensis egg. Photomicrograph of a Clonorchis sinensis egg, 400x magnification, the myricydium, larval stage of C. sinensis, green overlay, is visible inside the egg. The narrow end of the egg is covered by an operculum, resembling a cap, blue overlay, which is separated from the egg when the myricidium hatches. At the opposite, of opercular end, a small, comma-shaped knob, red overlay, is visible. This image is an adaptation. Source of original image, CDC. Original title, Phil ID #896. Created by, Melvin M. Licensed under public domain. Modifications to original image, cropped. Adult clonorchis sinensis. Photomicrograph of an adult clonorchis sinensis, H&E stain, low magnification. The shape of the trematode is elongated and slim with the anterior region narrowing into an oral sucker which is connected to the two lateral tubes, called ceca. Vitelline glands are visible on either side of the ceca. Inside the body, the medial, brown-black, coiled uterus and the posterior, pink-red, branch-like testes appear prominently. Source, Figure 2, in, liver fluke induces cholangiocarcinoma by Srpa B, Kux S, Sithithaworan P, Mariangi, Lahati, Smout M, ETAL, P. Loes Med, licensed under CC by 2.5. Modifications, image cropped from diagram adapted from https://www.dpd.cdc.gov/dpdx/html/opisdh-orchestra-yashas.htm. X. Human papillomavirus infection. The human papillomavirus, HPV, causes infections of the skin and mucous membranes. The locations and specific manifestations of infection depend on the type of virus and its mode of transmission. Many HPV strains are already spread during infancy and childhood through direct skin-to-skin contact and may remain dormant inside the cell, while others, especially HPV1, HPV2, and HPV4, can cause common warts, verruca vulgaris. Other strains are sexually transmitted, especially in young adults, and can be further divided into low-risk and high-risk HPV types. Low-risk types, especially HPV6 and HPV11, can cause benign anogenital warts, condylomata acuminata, and papillomatous nodules in other genital, example squamous intraepithelial lesions of the cervix, or non-genital, example oral warts, respiratory papillomatosis. Mucosal areas. Infection with oncogenic high-risk HPV types, especially HPV16 and HPV18, may lead to malignant disease. These high-risk strains account for more than 70% of cervical cancers and can also cause genital, oral, and oropharyngeal squamous cell cancers. Risk factors. Factors for infection include skin damage, immunocompromise, early first sexual intercourse, and frequent change of sexual partners. Most HPV infections are asymptomatic and self-limiting, although pruritus, tenderness, and bleeding may occur. Diagnosis is often based on the physical exam alone, but can be confirmed with diagnostic tests, example PCR, particularly in asymptomatic HPV infections of the cervix. Treatment of condylomas includes the use of local ointments, cryotherapy, and electrocoagulation. However, surveillance is important since recurrence rates are high and malignant transformation is possible. Prevention includes education about safe sexual practices and the proper use of condoms, as well as vaccination of all persons 9 to 26 years of age. Yes. Etiology. Human papillomavirus. Scent double-stranded, circular, non-enveloped DNA virus with an icosahedral capsid scent low-risk HPV type 6 and 11. Copyright anogenital warts, condylomata acuminata, 2 copyright mild cervical cell abnormalities copyright tumors of non-genital mucosal membranes, example respiratory tract, oral cavity, esophagus, eye, E. High-risk HPV type 16, 18, 31, and 33 OE cervical cancer, responsible for 70% of cases. 3. Copyright high risk of anogenital, oral, and oropharyngeal squamous cell carcinoma HPV types 1, 2, and 4, cause skin warts, such as common warts, verruca vulgaris, and plantar warts, myrmechias, route of transmission. Scent transmission occurs between two epithelial surfaces. E. Close personal contact, cutaneous warts. Copyright sexual contact, anogenital lesions. Risk factors 31. Damaged skin/mucous membranes, example maceration, trauma, herpes simplex virus infection, scent immunodeficiency, example HIV infection, chemotherapy. Scent additional risk factors for genital/mucosal HPV infections include O. Unprotected sex, O. Number of lifetime sexual partners, O. Early age at first sexual activity, E. Uncircumcised males. Pathogenesis. HPV expresses the following oncoproteins. Copyright E6 equals inhibition of p53 protein, inhibition of the intrinsic apoptotic pathway and inhibition of p21 protein. OE7 equals inhibition of retinoblastoma protein, PRB, increased activity of E2F family of transcription factors equals inhibits p21 and p27, CDK inhibitors, increased activity of cyclin-dependent kinase. And 6 comes before 7 and P comes before R, E6 inhibits P53 and E7 inhibits PRB. WI. A. Pathology ESTHIAT Chagius Z4MT equals 012401L10LAEHOS sets SPEL SLTS equals S set FALA TP cent epidermal hyperplasia and hyperkeratosis cent coilocytes eopathonemonic of an infection with HPV O dysplastic squamous cells characterized by well-defined, clear, balloon-like, perinuclear halo and hyperchromasia. RTBD. Back collapse. Fine text outline. Anogenital manifestations. Epidemiology. Most common sexually transmitted infection, STI, 4, E. Approximate 50% of new infections affect individuals between 15 to 24 years of age. 5 plus prevalence, 79 million in the US. 1 cent incidence, 14 million annually in the US. T. Genital intraepithelial neoplasms. E. Pathogen, HPV type 16 and 18 cent classification. E. Squamous intraepithelial lesion, SIL low grade, LSIL, or high grade, HSIL, 1, equals cervical intraepithelial neoplasia, CIN, vulvar intraepithelial neoplasia, VEN, vaginal intraepithelial neoplasia, VAL-N, penile intraepithelial neoplasia, PEL-N, perianal intraepithelial neoplasia, PAIN, anal intraepithelial neoplasia, N, OE. Squamous cell carcinoma equals cervical cancer equals vulvar cancer equals vaginal cancer equals carcinoma of the penis equals anal cancer. Bonoid papulosis. Description: an HSIL that resembles squamous cell carcinoma in situ on histology but tends to occur in younger individuals and has a lower risk of malignant transformation. Pathogen, most commonly HPV 16 location O$, vulvar O of, glans penis, foreskin, shaft, perianal region. Clinical features, multiple, flat, red-brown pigmented papules on the external genitalia. Diagnostics. Copyright visual inspection O. Biopsy, shows focal epidermal hyperplasia and epidermal dysplasia. Treatment O. Re-examination every 3 to 6 months, lesions often regress spontaneously. Copyright if persistent, local destructive therapy, see treatment of condylomata acuminata, followed by surveillance, annual examinations, since lesions may recur. Condylomata acuminata, anogenital warts. Pathogen, HPV type 6 and 11, responsible for 90% of genital warts. 2. Scent location O$, vulvar, cervix, anal region, urethra, rare, Yasko SSS Chola SSCOA SS Koto OL, smiley face, FO, tayo, OO, glans penis, foreskin, urethra, anal region LSI strats AR serotalk. OL NP scent clinical features O exophytic, cauliflower-like lesions copyright often asymptomatic, may cause pruritus, tenderness, or bleeding in rare cases scent diagnostics visual inspection copyright application of 5% acetic acid turns lesions white, not a specific finding, copyright biopsy indication 7. Immunodeficiency, example HIV infection, warts with atypical features, example affixed to underlying tissue, pigmented, indurated, bleeding, warts refractory to treatment scent treatment O pharmacotherapy, local cytostatic treatment, example 5-FU, trichloroacetic acid, podophyllin, salicylic acid, or immune response modifiers, example imicamod, interferon alpha, copyright cryotherapy, freezing external warts with no, or no copyright in case of numerous warts, curettage, laser surgery, or electrocoagulation. Back collapse fine text outline. Flat condylomata. E-pathogen, particularly HPV types 3 and 10 scent clinical features, flat, white-brown, slightly elevated, scattered plagues in the anogenital region scent diagnostics, visual inspection scent differential diagnosis, condylomata lata, usually flat, smooth, and moist, in syphilis scent treatment O curettage or laser surgery O regular checks, necessary because of the high risk of malignancy giant condylomata, Buschke-Lowenstein tumor. E-pathogen, primarily HPV type 6 and 11 scent clinical features, exophytic, verrucous, locally invasive squamous cell carcinoma without a tendency to metastasize scent diagnostics copyright visual inspection O biopsy scent treatment, surgical excision. WA. Fe, IEEE. Noninogenital manifestations. Epidemiology. Most common in infancy, childhood, and adolescence prevalence, 7 to 12% in the U.S. sex, 2 = 7. Common warts, verruca vulgaris. Scent pathogen, particularly low-risk HPV types 2 and 4 scent clinical features copyright lesions are plagues or papules skin-colored or whitish usually firm, often with a rough and scaly surface sometimes have a cauliflower-like appearance located on the elbows, knees, fingers, and / or palms copyright often asymptomatic but may cause tenderness, depending on the location, and pruritus scratching bleeding scent treatment. Copyright initially watchful waiting, most skin warts regress within 2 years, I8 copyright topical agents, example salicylic acid, cryotherapy, or surgical interventions. Plantar warts, verruca plantaris. Scent pathogen, particularly HPV types 1 scent clinical features sera SC tes ISIESCG or rough, hyperkeratotic lesions on the sole of the foot hinds are a rec copyright often grow inwardly and cause pain while walking TP. Flat warts, verruca plana. Scent pathogen, particularly HPV types 3 and 10 scent clinical features O multiple small, flat patches or plagues localized on the face, hands, and shins noninogenital mucosal manifestations. HPV types that cause mucosal manifestations in the genital area may also lead to noninogenital mucosal manifestations, such as scent oral warts and oropharyngeal carcinomas scent laryngeal papilloma, benign tumor of the laryngeal epithelium caused by HPV infection of the throat. Back collapse fine text outline. X-Riemann papillomavirus infection H. Noninogenital mucosal manifestations. HPV types that cause mucosal manifestations in the genital area may also lead to noninogenital mucosal manifestations, such as scent oral warts and oropharyngeal carcinomas laryngeal papilloma, benign tumor of the laryngeal epithelium caused by HPV infection of the throat O associated with HPV type 6 and 11 O appear as white, Exophytic cauliflower-like lesions located in the larynx, trachea, and on the vocal cords. Usually single lesions in adults and multiple in children. Can cause voice changes, example hoarseness, and, in more severe cases, airway obstruction. Laryngeal carcinoma, respiratory papillomatosis, and squamous cell carcinoma, SCC, of the lung. Conjunctival papillomas and conjunctival carcinoma. Differential diagnoses. C. Genital lesions. Benign tumors, example fibroids, papillomatous dermal nevi e molluscum contagiosum e. Malignant tumors, particularly squamous cell carcinomas. The differential diagnoses listed here are not exhaustive. WI. Rhesus. Treatment. There is no treatment for the infection itself. In most cases the infection clears up without any treatment. Several factors guide the choice of the treatment of anogenital warts, including wart characteristics, i.e., size, number, and anatomic site, patient preference, and potential adverse effects. Treatment options of HPV-related anogenital warts. Copyright routine clinical monitoring. Copyright local treatment with one of the following, podophyllitoxin imicamod. Mechanism of action, toll-like receptor 7 agonist activates immune cells, i.e., macrophages, monocytes, dendritic cells, indication, actinic keratoses, superficial basal cell carcinomas, herpes simplex infections, and anogenital warts. Adverse effects, burning pain at application site, dermal rash, pruritus. Trichloroacetic acid. Copyright cryotherapy. Copyright surgical removal, example tangential scissor, shave excision, curettage, laser, electrosurgery. Evidence of malignancy should always be excluded on HPV-related cervical lesions via cytological and histological monitoring. For treatment options of HPV-related cervical lesions, see treatment in cervical cancer. Reference: A7. OES. Prognosis. A high rate of recurrence. Infection with high-risk types may transition to precancerous or malignant lesions after several years. 3. FO equals AO. Collapse. Fine text outline. OXO. Prognosis. High rate of recurrence. Infection with high-risk types may transition to precancerous or malignant lesions after several years. 3. WA. FA, ISIS. Prevention. Education about possible risk factors and effective preventive measures, such as 3-co-HPV vaccine, human papillomavirus 9-valent vaccine, Raj-8A 9-valent inactivated vaccine that is made from the L1 protein of the human papillomavirus types 6, 11, 16, 18, 31, 33, 45, 52, and 58 provides protection against genital warts and cervical cancer. See the ACIP immunization schedule for scheduling details. Use of condoms. Condoms decrease the risk of infection but do not provide full protection, as uncovered areas may still be infected. 3. WA. FO, IEEE. Special patient groups. Pregnancy, 1. Transmission. Copyright vertical transmission to the fetus is rare but may lead to laryngeal papillomatosis. Airway obstruction conjunctival papillomatosis. Treatment / prevention. Copyright vaccination should be avoided during pregnancy. Copyright trichloroacetic acid is preferred. Copyright cryotherapy and surgical interventions are also safe. Copyright podophyllin, 5-FU, and interferon are teratogenic and contraindicated in pregnancy. Delivery. Cesarean section does not prevent vertical transmission of HPV. Cesarean section is indicated only if the birth canal is obstructed by large genital warts. Condylomata acuminata in children. Transmission. Copyright autoinoculation transmission of HPV from other cutaneous or mucosal sites of infection, example transmission from the anogenital region to the hands, equals most common form in children O heteroinoculation, transmission of HPV from close skin contact, example bathing, diaper changing, copyright sexual, transmission from sexual abuse, 121 copyright perinatal transmission, example during vaginal delivery, or prenatal transmission, example due to ascension of HPV into the uterus, O fomite. Transmission, example contaminated towels, scent diagnostics copyright the possibility of sexual abuse should always be considered. Copyright see diagnostics in condylomata acuminata above for details. Scent management watchful waiting, most lesions resolve spontaneously within a few years. 13 copyright if warts persist or lesions become symptomatic, example pruritus, bleeding, pain equals topical agents, example imiquimod, podophyllitoxin, equals surgical or laser therapy for extensive or large warts, equals 1 cm. OSCO. Sources. Last updated April 26, 2023. Equals QL. Collapse fine text outline. Human papillomavirus infection, 1/1. Pap smear showing low-grade dysplasia VV. Photomicrograph of a cervical pap smear, papanicle low stain, high magnification, normal superficial squamous cells, pink cytoplasm, as well as some intermediate squamous cells are visible. In the center of the image is an irregular clump of koilocytes, marked by an arrow. The koilocytes are characterized by perinuclear halos and show slight nuclear enlargement with irregularly distributed chromatin. They may also exhibit binucleation. These are typical features of a low-grade squamous intraepithelial lesion, LSIL. Source: low-grade squamous intraepithelial lesion by Nephron, Wikimedia Commons, licensed under CC by SA 3.0. Modifications, added arrow. Bonoid papulosis VV. Labia majora of an immunocompetent patient with an infiltrative and eroded tumor, arrow. Multiple flat and hyperpigmented patches are disseminated over the patient's upper labia majora. These patches suggest bonoid papulosis, caused by human papillomavirus, HPV, infection. Histopathologic examination is necessary to confirm the diagnosis. Source: Fig 7a, in Update on Human Papillomavirus, Art, Epidemiology, Pathogenesis, and Clinical Spectrum by Majla Magalhaes G, Vieira E.C., Campos Garcia L., Dolores Ribeiro de Carvalho Lita M., Martins Guidiz A.C., Grassi Araujo M., ABD, licensed under CC by 4.0. Modifications, image cropped. Human papillomavirus infection, 2/5. Anogenital warts, condylomata acuminata. Multiple exophytic, cauliflower-like, confluent, erythematous lesions are seen in the perianal region. Anogenital warts, condylomata acuminata, VV. Multiple exophytic, cauliflower-like, confluent, skin-colored papules are visible in the perianal region. Source: Copyright IMPP. Human papillomavirus infection, 4/5. Condylomata acuminata. Confluent nodular, cauliflower-like, varicose lesions are visible on the entire labia and the anogenital region. These findings are characteristic of condylomata acuminata, which are mostly caused by infection with HPV types 11 and 16. Source: Phil ID #16734, CDC/Susan Lindsley, Centers for Disease Control and Prevention, Atlanta, USA. Licensed under public domain. Human papillomavirus infection, 5/5. Perianal warts, condylomata acuminata, v. Multiple flesh-colored papules with a folded irregular surface have formed a plaque in this patient's perianal region. These findings are typical of condylomata acuminata due to HPV infection. Source: Figure 31, in Atlas of Pediatric HIV Infection by Regina E. Oladican, Raniko J. Leloania, Carol Hlila et.al, Open Books, licensed under CC by ND 4.0. Human papillomavirus infection, 1/6. Common warts VV. Partially confluent, hyperkeratotic papules with a rough surface are seen on the dorsal surface of the hand at the level of the metacarpophalangeal joint. Source: Copyright IMPP. Common warts, verrucae vulgars, VV. Multiple whitish plaques and papules are visible on the distal end of the fingers. A larger hyperkeratotic plaque with a verrucous and scaly surface can be seen on the distal end of the left thumb. Common warts are typically associated with HPV infection. Source: Figure 29, in Atlas of Pediatric HIV Infection by Regina E. Oladican, Raniko J. Leloania, Carol Hlila et.al, Open Books, licensed under CC by ND 4.0. Human papillomavirus infection, 3/6. Plantar wart. 2 round, well-defined, flat lesions with a rough keratotic surface are visible on the plantar surface of the great toe. Source: Verruca vulgaris on the first toe bind no, Wikimedia Commons, licensed under CC by SA 3.0. Copyright overlay. Plantar wart VV. There is a solitary, well-defined, rough, flat hyperkeratotic lesion with dark spots, clotted capillaries, examples indicated by arrowheads, on the plantar aspect of the foot. Plantar warts are caused by HPV infection, particularly types 1, 2, and 4. Source: FVRPLA2 by Armin E. Opitz, Wikimedia Commons, licensed under CC by SA 2.0. Human papillomavirus infection, 5/6. Flat warts, verrucae plani, VV. Forehead of a child with epidermodysplasia verruciformis. Multiple small, flat, and hyperpigmented patches or plaques can be seen. The pityriasis versicolor-like surface of the lesions as well as the location on the head are typical of infection with benign HPV subtypes. Source: Figure 26a, in Atlas of Pediatric HIV Infection by Regina E. Oladican, Raniko J. Leloania, Carol Hlila et.al, Open Books, licensed under CC by ND 4.0. Human papillomavirus infection, 6/6. Oral condyloma VV. Exophytic, cauliflower-like, clustered papules are seen behind the upper row of teeth in the oral cavity of a patient with HPV/HIV co-infection. Source: ID #6056, CDC/Sol Silverman, Jr., DDS, Centers for Disease Control and Prevention, CDC, licensed under public domain. X. Pyelonephritis. Pyelonephritis is an infection of the renal pelvis and parenchyma that is usually associated with an ascending bacterial infection of the bladder. It occurs more commonly in women and risk factors include pregnancy and urinary tract obstruction. Patients typically present with flank pain, costovertebral angle tenderness, fever, and other features of cystitis, example dysuria, frequency. Urinalysis shows pyuria and bacteriuria. Urine cultures should be taken in all patients before initiating treatment to identify the pathogen and possible antibiotic resistance. Early empiric antibiotic treatment is essential to avoid renal complications and urosepsis. Definitive treatment depends on the drug sensitivities of the causative pathogen and the patient's clinical profile, example possible comorbidities. See also urinary tract infections. OC. CES. Etiology. Usually caused by an ascending bacterial infection of the bladder, cystitis, less commonly due to hematogenous spread of infection to the kidney, example infectious endocarditis, Pathogens: O gram-negative bacteria equals Escherichia coli, 75 to 90% of cases. Leading cause of pyelonephritis equals Pseudomonas aeruginosa equals Klebsiella pneumoniae equals Proteus mirabilis. O gram-positive bacteria equals Enterococcus faecalis equals Staphylococcus aureus Staphylococcus saprophyticus 2. Copyright Candida infection, especially in immunocompromised patients, is possible. Scent risk factors for pyelonephritis. EO most common in women because they have shorter urethras. O pregnancy. Copyright urinary tract obstruction, potentially leading to pyenephrosis, equals foreign bodies, example indwelling urinary catheters or other urologic instrumentation, anatomical abnormalities, example benign prostatic hyperplasia, vesicoureteral reflux, nephrolithiasis, ureteral strictures. Copyright cystitis. Copyright recent administration of antibiotics, possible antibiotic resistance. O immunosuppression, example HIV, diabetes mellitus. Copyright renal transplant 2, SIL 4. O. AE. Classification. The terminology used for classifying pyelonephritis is somewhat controversial and serves primarily to estimate the risk of atypical or antibiotic-resistant pathogens. Uncomplicated pyelonephritis, pyelonephritis in an immunocompetent, non-pregnant female with normal genitourinary anatomy and renal function. SLILT 7 ITS, scent complicated pyelonephritis, pyelonephritis associated with any of the following risk factors for complications, TELS. Degree failure of outpatient therapy. Sepsis. Male, sex, age 60 years. Urinary tract abnormalities, example obstruction, indwelling catheter, history of surgery to the urinary tract or kidneys. Hospital acquired infection. Renal impairment. History of nephrolithiasis. Immunosuppression and/or severe comorbidities, example diabetes mellitus, chronic corticosteroid use, pregnancy. Degree. OO. CE. Clinical features. E. Fever, chills. Back collapse. Fine text outline. Clinical features. Scent: fever, chills. Scent: flank pain, costovertebral angle tenderness, pain upon percussion of the flank, usually unilateral, maybe bilateral, dysuria as well as other symptoms of cystitis, example frequency, urgency, weakness, nausea, vomiting, diarrhea may also be present. Scent: possible abdominal or pelvic pain. AD. Suspect pyelonephritis in any patient presenting with fevers, chills, and flank pain, irrespective of lower urinary tract symptoms. AD. Pyelonephritis symptoms may overlap with those of other life-threatening causes of flank pain. See differential diagnosis of pyelonephritis. Diagnostics. Laboratory tests. Scent urinalysis. MLD. Copyright nonspecific findings of UTI pyuria, positive esterase on dipstick test, leukocyturia, WBCs 5/HPF, equals bacteriuria equals positive nitrites on dipstick test indicate bacteria that convert nitrates to nitrites. A. Hematuria, including microhematuria. Copyright other findings. WBC casts, rare finding, but considered to be a strong indicator for pyelonephritis. 9, 6L, 10 equals urine pH of equals 7.5 to 8.0, associated with urease-producing organisms. 11 121 T1 epithelial cells 5/HPF, suggests contamination. Gram stain, direct visualization of bacteria, seldom performed. Scent urine culture with susceptibilities. O. Perform in all patients with suspected pyelonephritis to determine the pathogen and any associated drug resistance. Copyright equals 105 colony forming units/ml suggests bacterial infection. See urine culture for more details. 130-114I. Blood cultures. 2 sets should be performed in all patients with suspected complicated pyelonephritis. Scent urine pregnancy test in women of childbearing age, Sent additional blood tests copyright CBC, leukocytosis copyright inflammatory markers, TCRP-ESROBMP, may be normal or show elevated BUN and creatinine SS. Add, collect urine and blood cultures before administering empiric antibiotic therapy. AA Imaging 5. Indications. Scent imaging is not routinely indicated in patients with suspected acute uncomplicated pyelonephritis. Imaging serves to identify obstruction, abscess, or emphysema to pyelonephritis. Consider in the following situations: IU, copyright complicated pyelonephritis, copyright sepsis or septic shock, copyright known or suspected nephrolithiasis 1, 6, copyright new decline in EGFR2. Back collapse, find text. O. Outline. CT abdomen and pelvis with and without for contrast 18. Modality of choice in non-pregnant patients who need imaging. Scent findings supportive of pyelonephritis. Renal parenchyma may appear normal, early, or edematous O infected parenchyma may be visible as wedge-shaped areas of streaky contrast enhancement, striated nephrogram. 18. Scent findings supportive of urinary tract obstruction O hydroureter, hydronephrosis O nephrolithiasis, urolithiasis. Scent other findings that may be present copyright congenital abnormalities of the renal tract O abscess O emphysema 2 pyelonephritis, presence of gas within the renal parenchyma, collecting system or paranephric spacing EO hemorrhage in the parenchyma. Ultrasound of the kidneys and bladder, 181. Scent indications, patients with contraindications to CT scan, example allergy to contrast, findings supportive of pyelonephritis O renal enlargement copyright loss of corticomedullary differentiation O edema EO hemorrhage in the parenchyma O abscess. Scent findings supportive of urinary tract obstruction O hydroureter, hydronephrosis thickened bladder wall high bladder residual volume O prostate enlargement. Scent disadvantages, low sensitivity compared to CT, particularly in early acute infections 118. Pathology. Scent acute pyelonephritis OE most commonly affects the cortex, spares glomeruli and vessels, O purulent inflammation of the interstitium with destruction of the parenchyma, the renal tubules, and, in some cases, the renal pelvis. Copyright histology equals neutrophilic infiltration of the renal tubules and the interstitium equals sparing of the glomeruli and interarenal vessels. Scent chronic pyelonephritis copyright chronic inflammatory changes with rough, asymmetric scarring and fibrosis of the corticomedullary junction O blunted calyces from recurrent urinary reflux. Copyright histology, eosinophilic casts in the tubules that resemble thyroid tissue with colloid, thyroidization of the kidney, xanthogranulomatosis. Pyelonephritis equals form of chronic pyelonephritis characterized by chronic destructive granuloma formation associated with Proteus mirabilis and Escherichia coli infections. Equals large, irregular, yellow-orange masses on gross examination of the kidney, may be mistaken for a true renal neoplasm. Equals histology, granulomatous tissue with lipid-laden foamy macrophages and multinucleated giant cells. Back collapse, find text outline. Differential diagnoses. See also differential diagnoses of acute abdomen and differential diagnoses of acute back pain. Scent other kidney and urinary tract disorders O lower UTIs. Copyright renal colic O renal vein thrombosis. Copyright renal infarct. Scent other intra-abdominal, retroperitoneal, and pelvic disorders O psoas abscess. Copyright splenic infarct or abscess O retroperitoneal hematoma or infection. Copyright acute cholecystitis EO appendicitis. Copyright diverticulitis. Copyright pelvic inflammatory disease EO endometriosis. Scent disorders outside the abdomen, pelvis, and retroperitoneum musculoskeletal disorders, example spinal, paraspinal, O pleural empyema O pulmonary infarct. Copyright shingles. The differential diagnoses listed here are not exhaustive. OS. Rouchier. Treatment. Antibiotic therapy, source control, and supportive care are the mainstays of treatment of pyelonephritis. The choice of empiric antibiotic regimen should be guided by the risk of infection with resistant organisms, ICENT. Complicated versus uncomplicated pyelonephritis, and antibiotics should be tailored as soon as culture results become available. Consider specialist consultation in cases of complicated pyelonephritis, especially if urinary tract obstruction is suspected. Uncomplicated pyelonephritis/IL-71I241. Plus empiric antibiotic therapy for uncomplicated pyelonephritis 241. O alternatives equals trimethoprim sulfamethoxazole, for 10 to 14 days, only recommended if susceptibility is known. 5-iomoxicillin clavulinate for 10 to 14 days 24 equals cefpodoxim for 10 to 14 days 241. Copyright consider a single dose of a broad-spectrum parenteral antibiotic prior to the administration of oral antibiotics, especially when the local rates of drug-resistant E. coli are unknown or known to be 10%. 241 equals ceftriaxone equals or gentamicin 251 24 supportive care. Encourage the patient to drink adequate amounts of fluids. Additional considerations. Copyright outpatient treatment is generally appropriate. If there is no response within 48 hours of starting empiric antibiotic therapy, equals consider imaging to evaluate for urinary tract obstruction or formation of renal abscess, see diagnostics. Equals check urine culture results and adjust treatment accordingly. 1. Back collapse. Find text outline. Repeat urine culture, i.e., test for cure, is not routinely indicated. 5. Complicated pyelonephritis/IL-71I24. Patients with complicated acute pyelonephritis should be admitted to the hospital and started on parenteral empiric antibiotic therapy as soon as possible. 5. IL-2 empiric antibiotic. Patient characteristics. Not severely ill and no risk factors for multi-drug are bacterial. Severely ill, i.e., septic, and/or with risk factor, S, for multi-drug resistant gram-negative bacterial infection. Enterococcus or MRSA suspected. Therapy for PLE. Antibiotic regimens to consider one of the following. Copyright fluoroquinolone equals ciprofloxacin equals levofloxacin EO an extended spectrum cephalosporin equals ceftriaxone equals cefotaxime equals cefepime. Copyright an extended spectrum penicillin with a B-lactamase inhibitor, example piperacillin tazobactam. Consider adding an aminoglycoside until culture results are available. Gentamicin tobramycin. One of the following. Carbapenem equals meropenem equals doropenem equals ertapenem an extended spectrum penicillin with a B-lactamase inhibitor, example piperacillin tazobactam. Aztreonam. Copyright an extended spectrum cephalosporin equals ceftriaxone equals ceftazidime equals cefepime. Consider adding an aminoglycoside until culture results are available. Gentamicin tobramycin. Consider colistin if there is a known MDR organism with resistance to aminoglycosides and carbapenems. Consider adding vancomycin. Or if there is concern for VRE, add one of the following. Copyright daptomycin linezolid. Copyright pathogens. Fluoroquinolone monotherapy should be avoided in severely ill patients with complicated pyelonephritis due to the high prevalence of fluoroquinolone resistant. Supportive care. Copyright analgesics as needed, C. Pain management, O. Antiemetics as needed. Additional considerations. O. Aggressive for resuscitation for patients with sepsis, C. For fluid therapy. Copyright source control. Consider imaging to identify urinary obstruction, see diagnostics above. Subsequent management. O. Duration of antibiotic therapy, 10 to 14 days 24. Copyright antibiotic therapy should be adjusted once blood and urine culture sensitivity reports are available. Copyright consider repeat urine culture in pregnant women and those with recurrent pyelonephritis 2 to 4 days after completion of the antibiotic course. O. Identify and treat the underlying cause. 529. Copyright patients with concurrent urinary tract obstruction are at very high risk of clinical deterioration and require immediate intervention to remove the obstruction. OE. OES. Complications. Scent urosepsis, septic shock, scent perinephric abscess, renal abscess, renal papillary necrosis plus emphysema 2 pyelonephritis. Registered. Copyright rare form of pyelonephritis characterized by gas formation within and around the kidney, most common in patients with poorly controlled diabetes or immunodeficiency. Copyright typically caused by E. coli or K. pneumoniae. Back. ODNN collapse. QL. Find text. Al. Outline. Emphysema 2 pyelonephritis. Copyright rare form of pyelonephritis characterized by gas formation within and around the kidney, most common in patients with poorly controlled diabetes or immunodeficiency. Copyright typically caused by E. coli or K. pneumoniae. Copyright treatment includes 4 antibiotics, percutaneous drainage, and, in some cases, nephrectomy. Recurrent bacterial pyelonephritis. If recurrence is caused by the same organism despite adequate treatment, then prolong the course of antibiotics for 6 weeks. Copyright if a new pathogen is identified, change antibiotics accordingly and treat for 2 weeks. Atrophic kidneys. End-stage renal disease, ESRD. If both kidneys are affected, the patient has a single kidney, or the other kidney has been damaged by a different pathology. Rule out urosepsis in elderly patients with altered mental status. We list the most important complications. The selection is not exhaustive. OO. CE. Special patient groups. See also urinary tract infections in children and adolescents. Pyelonephritis in pregnancy 24LL1. Asterisk diagnosis, see diagnostics above. The imaging modality of choice in pregnancy is MRI. 18. Epidemiology. Copyright the risk of pyelonephritis is increased during pregnancy. As many as 1/3 of pregnant women with asymptomatic bacteriuria will progress to develop pyelonephritis, if left untreated. Copyright one of the most common complications of pregnancy, with potentially severe consequences for both mother and fetus. 1. Treatment 24LL1. Copyright hospitalization is recommended. Definitive indications for hospitalization are 34 signs of sepsis, dehydration, example due to vomiting, equals contractions. Copyright a third or fourth generation cephalosporin. Copyright parenteral broad-spectrum antibiotics are recommended at least until the patient is afebrile, after which transition to oral antibiotics, example penicillins, cephalosporins, is possible. 8 degrees, copyright C. Antibiotics during pregnancy. Copyright all asymptomatic cases of bacteriuria during pregnancy must be treated to prevent the development of pyelonephritis. Avoid fluoroquinolones, trimethoprim/sulfamethoxazole, and aminoglycosides in pregnant women. OO. OE. Chronic pyelonephritis. Description: a consequence of recurrent or persistent acute pyelonephritis. Predisposing factors: O. Vesico-ureteric reflux. Copyright urinary tract obstruction, example nephrolithiasis, neurogenic bladder. Clinical features: O. Nonspecific, mild fever, anorexia, malaise, abdominal or flank pain. Diagnostics: O. Urinalysis, pyuria, proteinuria, WBC casts. Copyright imaging, ultrasound, intravenous urogram. Corticomedullary scarring, mainly upper pole, blunt/clubbed renal calyces. Ca. Copyright biopsy. Thyroidization of the kidney, C. Pathology. Treatment. Copyright treat the underlying cause. Degree antibiotics. 1. Back. DT. A collapse. A. Find text. Outline. Kurentochnen abstrefen, Abelsen nach dip briefly remove Euro XC Euro SS urine, read Sumeria brevement, eliminate L exis gen in mergit repeatment, eguter ine onset omi. Urinalysis, urine analysis, test strip VV. Left, test strip following immersion in urine. Right, test strip packaging with instructions on how to interpret findings. Source, urine quick test by Uwe Gill, Wikimedia Commons, licensed under CC by SA 3.0. Euro ___pyelonephritis, 2/11. Pyuria and bacteriuria on microscopy. Photomicrograph of a urine specimen, high magnification, multiple white blood cells, large, light-colored structures, and bacteria, small black structures, are visible. The presence of white blood cells, pyuria, and bacteria, bacteriuria, in the urine is characteristic of urinary tract infection. Source, Bacteriuria Pyuria 4 by Stephen Fruitsmock, Wikimedia Commons, licensed under CC by SA 3.0. Euro ___ pyelonephritis, 3/11. Equals. I. Wisplinghoff Laboratories. White blood cell casts V. Photomicrograph of urine sediment, phase contrast microscopy, high magnification, white blood cell, WBC, casts, blue overlay, contain leukocytes, examples outlined in yellow, that are compressed in a matrix. Sharp margins are characteristic of WBC casts, differentiating them from randomly assembled leukocyte conglomerates. Our great thanks to Dr. Wisplinghoff, Dr. Wisplinghoff's laboratory, for kindly providing this image. Euro ___ pyelonephritis, 3/11. I. Wisplinghoff Laboratories. Overall. White blood cell casts V. Photomicrograph of urine sediment, phase contrast microscopy, high magnification, white blood cell, WBC, casts, blue overlay, contain leukocytes, examples outlined in yellow, that are compressed in a matrix. Sharp margins are characteristic of WBC casts, differentiating them from randomly assembled leukocyte conglomerates. Our great thanks to Dr. Wisplinghoff, Dr. Wisplinghoff's laboratory, for kindly providing this image. E.I. Wisplinghoff Laboratories. Overall. Granular cast in urine sediment VV. Photomicrograph of urine sediment, phase contrast microscopy, high magnification, the granular cast in the center of the image is comprised of a hyaline matrix, green overlay, with large droplets of plasma proteins embedded within. Granular casts can be an indication of proteinuria, example in glomerulonephritis or pyelonephritis. However, they may also be present in healthy individuals, example after severe physical stress. Our great thanks to Dr. Wisplinghoff, Dr. Wisplinghoff's laboratory, for kindly providing this image. Pyelonephritis, 4/11. E.I. Wisplinghoff Laboratories. Overall. Granular cast in urine sediment VV. Photomicrograph of urine sediment, phase contrast microscopy, high magnification, the granular cast in the center of the image is comprised of a hyaline matrix, green overlay, with large droplets of plasma proteins embedded within. Granular casts can be an indication of proteinuria, example in glomerulonephritis or pyelonephritis. However, they may also be present in healthy individuals, example after severe physical stress. Our great thanks to Dr. Wisplinghoff, Dr. Wisplinghoff's laboratory, for kindly providing this image. Euro __ pyelonephritis, 5/11. Overall. Acute pyelonephritis and renal calculi VV. CT abdomen, with 4 contrast, venous phase, axial plane, of a patient with acute pyelonephritis. The left ureter and renal pelvis are slightly dilated, red overlay, and contain hyperdense calculi, white arrowheads. The left kidney is larger than the right and the left renal parenchyma, green overlay, shows reduced contrast enhancement. There is also paranephric stranding, yellow overlay and white arrow, which is an important sign of renal inflammation or obstruction. V. Inferior vena cava, A. Aorta source, copyright IMPP. Euro__pyelonephritis, 5/11. Overall. Acute pyelonephritis and renal calculi VV. CT abdomen, with fore contrast, venous phase, axial plane, of a patient with acute pyelonephritis. The left ureter and renal pelvis are slightly dilated, red overlay, and contain hyperdense calculi, white arrowheads. The left kidney is larger than the right and the left renal parenchyma, green overlay, shows reduced contrast enhancement. There is also paranephric stranding, yellow overlay and white arrow, which is an important sign of renal inflammation or obstruction. V. Inferior vena cava, A. Aorta source, copyright IMPP. Striated nephrogram VV. MRI abdomen, kidneys, T1 weighted fat saturated, with contrast, arterial phase, alternating high and low attenuation linear bands, striations, arrows, radiate through the cortex and medulla of the kidney parallel to the axis of tubules and collecting ducts. A striated nephrogram can result from stasis and concentration of contrast in edematous or necrotic renal tubules. Source, Figure 3, in Allergic interstitial nephritis manifesting as a striated nephrogram by Efron Moinadin, Erica Bracamonte, Bijan Thajadine, Amy Sussman, Muchaya Madrira, and James Costello, Case Reports in Medicine, licensed under CC by 3.0. Euro__pyelonephritis, 7/11. Sethyanik, 13 hours 8 minutes and 28 seconds MRN. Chronic ureteral obstruction. CT abdomen and pelvis, without contrast, coronal plane, of a patient with a history of neurogenic bladder and recurrent urinary infections. The renal calyces, pelvis, and ureters are dilated, green overlay, with normally concave, cup-shaped, renal calyces appearing convex, club-shaped, examples indicated by arrowheads. Thinning of the renal parenchyma, examples indicated by white dashed lines on the parenchymal edge, suggests that the dilatation is chronic rather than acute. Marked thickening of the bladder wall, red overlay, is likely responsible for chronic ureteral obstruction. RAFI, coronal view, confirmed moderately severe bilateral hydronephrosis and hydroureter by Subramanian Valdivanatian, Fahd Selmi, Kadaradal Abraham, Peter Hughes, Gurpreet Singh and Bakul Soni, Patient Safety in Surgery Journal, licensed under CC by 2.0. Euro__pyelonephritis, 7/11. Terdiane, 13 hours 8 minutes and 28 seconds. MRN. Chronic ureteral obstruction. CT abdomen and pelvis, without contrast, coronal plane, of a patient with a history of neurogenic bladder and recurrent urinary infections. The renal calyces, pelvis, and ureters are dilated, green overlay, with normally concave, cup-shaped, renal calyces appearing convex, club-shaped, examples indicated by arrowheads. Thinning of the renal parenchyma, examples indicated by white dashed lines on the parenchymal edge, suggests that the dilatation is chronic rather than acute. Marked thickening of the bladder wall, red overlay, is likely responsible for chronic ureteral obstruction. RAFI, coronal view, confirmed moderately severe bilateral hydronephrosis and hydroureter by Subramanian Valdivanatian, Fahd Selmi, Kadaradal Abraham, Peter Hughes, Gurpreet Singh and Bakul Soni, Patient Safety in Surgery Journal, licensed under CC by 2.0. Overall. Ureter calculus with hydronephrosis VV. CT abdomen, without contrast, axial plane, the rounded hyperdense structure, red arrow, medial to the left kidney is a ureteral calculus. Mild dilatation of the ureter, green overlay, is also visible. An additional, very small calculus, red overlay, is present in a dilated calyx. K. Kidney source, Midureter stone hydro by James Heilman, MD, Wikimedia Commons, licensed under CC by SA 3.0. Modifications, arrow removed. Overall. Ureter calculus with hydronephrosis VV. CT abdomen, without contrast, axial plane, the rounded hyperdense structure, red arrow, medial to the left kidney is a ureteral calculus. Mild dilatation of the ureter, green overlay, is also visible. An additional, very small calculus, red overlay, is present in a dilated calyx. K. Kidney source, Midureter stone hydro by James Heilman, MD, Wikimedia Commons, licensed under CC by SA 3.0. Modifications, arrow removed. Euro__pyelonephritis, 9/11. Overall. Pyelonephritis VV. Ultrasound kidney, longitudinal plane, the renal sinus and cortex, C, are not well differentiated from one another. Much of the central kidney is replaced by a poorly marginate area of hyperechogenicity, green overlay. Source, Figure 26, in Ultrasonography of the Kidney, a pictorial review by Christopher Linskov Hansen, Michael Bachmann-Nielsen, Caroline Uertzen, Diagnostics, licensed under CC by 4.0. Euro__pyelonephritis, 9/11. Overall. Pyelonephritis VV ultrasound kidney, longitudinal plane, the renal sinus and cortex, C, are not well differentiated from one another. Much of the central kidney is replaced by a poorly marginate area of hyperechogenicity, green overlay. Source, Figure 26, in Ultrasonography of the Kidney, a pictorial review by Christopher Linskov Hansen, Michael Bachmann-Nielsen, Caroline. Euro__pyelonephritis, 10/11. Hydronephrosis. Ultrasound left kidney, longitudinal plane, the calyces, green overlay, are dilated and have lost their normal cup-shaped appearance. Flattening of papillae and blunting of fornices can be seen. Where visible, the renal cortical parenchyma is not thinned. RP, renal parenchyma, arrowheads, hyperechoic renal sinus source, ultrasonographic picture taken from a patient with left ureteral stone with hydronephrosis, created in Taiwan by Morning 2K, Wikimedia Commons, licensed under CC by SA 3.0. Euro__pyelonephritis, 10/11. Hydronephrosis. Ultrasound left kidney, longitudinal plane, the calyces, green overlay, are dilated and have lost their normal cup-shaped appearance. Flattening of papillae and blunting of fornices can be seen. Where visible, the renal cortical parenchyma is not thinned. RP, renal parenchyma, arrowheads, hyperechoic renal sinus source, ultrasonographic picture taken from a patient with left ureteral stone with hydronephrosis, created in Taiwan by Morning 2K, Wikimedia Commons, licensed under CC by SA 3.0. Overall. Obstructing ureteral calculus VV. Excretory urography, AP view, left, pre-contrast, right, 2.5 hours post-contrast, a calcification medial to the lower pole of the right kidney on the pre-contrast radiograph, red overlay, is shown post-contrast to be an obstructing proximal ureteral calculus, UC, red overlay. The right kidney is enlarged, with persistent enhancement, green overlay. There is pelvic aleectasis and poor contrast filling of the right ureter, region indicated by dashed lines. The left renal collecting system is normal, green overlay. RP, renal pelvis, U, ureter, UB, urinary bladder source, copyright IMPP. Overall. Obstructing ureteral calculus VV. Excretory urography, AP view, left, pre-contrast, right, 2.5 hours post-contrast, a calcification medial to the lower pole of the right kidney on the pre-contrast radiograph, red overlay, is shown post-contrast to be an obstructing proximal ureteral calculus, UC, red overlay. The right kidney is enlarged, with persistent enhancement, green overlay. There is pelvic aleectasis and poor contrast filling of the right ureter, region indicated by dashed lines. The left renal collecting system is normal, green overlay. RP, renal pelvis, U, ureter, UB, urinary bladder source, copyright IMPP. Overall. Acute pyelonephritis Y. Photomicrograph of a renal tissue biopsy specimen, H&E stain, very high magnification, areas of neutrophilic infiltration are visible throughout the renal interstitium, example indicated by hatched green overlay, especially in the tubules, example indicated by green overlay, which appear dilated. These findings suggest acute pyelonephritis. Source, acute pyelonephritis, 2, very high mag by nephron, Wikimedia Commons, licensed under CC by SA 3.0. Overall. Acute pyelonephritis VV. Photomicrograph of a renal tissue biopsy specimen, H&E stain, very high magnification, areas of neutrophilic infiltration are visible throughout the renal interstitium, example indicated by hatched green overlay, especially in the tubules, example indicated by green overlay, which appear dilated. These findings suggest acute pyelonephritis. Source, acute pyelonephritis, 2, very high mag by nephron, Wikimedia Commons, licensed under CC by SA 3.0. Chronic pyelonephritis kidney specimen. Macroscopic preparation of a kidney specimen. There are multiple irregular areas of fibrosis. This is the typical appearance of fibrosis in chronic pyelonephritis. Source, copyright IMPP. Pyelonephritis, 3/3. PAETE, NGEE, 2 at, IAEOE PAES at DIG. Chronic pyelonephritis. Photomicrograph, H&E stain, 150x magnification, of an autopsy kidney specimen of a 60-year-old patient with prostate and bladder carcinoma. A chronic interstitial infiltrate, highlighted red, is seen in scarred fibrous tissue, highlighted green, replacing most of the renal parenchyma. Tubules are partly atrophic with flattened epithelia, arrowheads, or cystically dilated with colloid-like luminal material, so-called tubular thyroidization because of its resemblance of thyroid follicles. A single normal glomerulum, marked G, can be seen. The overall reduced thickness of the parenchyma speaks for a dilated renal pelvis and an obstructive problem, e.g. by tumor or after radiation. These findings are consistent with chronic pyelonephritis. Source, copyright IMPP. Chronic pyelonephritis. Photomicrograph, H&E stain, 150x magnification, of an autopsy kidney specimen of a 60-year-old patient with prostate and bladder carcinoma. A chronic interstitial infiltrate, highlighted red, is seen in scarred fibrous tissue, highlighted green, replacing most of the renal parenchyma. Tubules are partly atrophic with flattened epithelia, arrowheads, or cystically dilated with colloid-like luminal material, so-called tubular thyroidization because of its resemblance of thyroid follicles. A single normal glomerulum, marked G, can be seen. The overall reduced thickness of the parenchyma speaks for a dilated renal pelvis and an obstructive problem, e.g. by tumor or after radiation. These findings are consistent with chronic pyelonephritis. Source, Copyright IMPP. Uropyelonephritis, 1/1. Suspected acute pyelonephritis. E fever, chills, E flank pain, CVA tenderness, E lower urinary tract symptoms. 1. Check vitals. Hemodynamic EC fluid resuscitation, admit to instability. ICU, initiate sepsis workup. No. V. Sent CBC, BMP, CRP. E urinalysis and urine culture. I uncomplicated complicated pyelonephritis. Indications for initial imaging. Sent new eGFR decrease to E recurrent pyelonephritis. V sent obtain blood cultures, perform CT, 2 sets, abdomen with and sent perform CT abdomen no without contrast with and without contrast. No abscess, obstruction, 1 cernin, emphysema 2 Lee findings pyelonephritis. E persistent nausea/vomiting, E ongoing hypovolemia, E4 fluids, E no suitable antibiotic, yes, and E4 empiric antibiotics, E poor adherence to medication/E analgesia, antiemetics, poor social support, no. Outpatient complications management present. Consider single dose of 4-ceftriaxone or gentamicin U prior to PO antibiotics if life-threatening. Local rates of drug-resistant R abscess obstruction, urosepsis, SS shock, none. E. coli are unknown or high. E. adjust antibiotic therapy according to blood and urine culture sensitivities. E. identify and reverse risk factors, example neurogenic bladder, Foley catheter. A. febrile for AR clinical improvement at least 48 HR within 48 HR. E. switch to PO antibiotics and follow-up outpatient. E. repeat renal imaging or consider MRI. Consider repeat urine culture in pregnant women to rule out abscess, emphysema 2 and those with recurrent pyelonephritis 2 to 4 days pyelonephritis, obstruction after completion of antibiotic course. Treat accordingly. Management of acute pyelonephritis VV. Copyright Boss. X. Urinary tract infections in children and adolescents. A urinary tract infection is an infection of the bladder, urethra, ureters, and/or kidneys and is a common infection in infancy and childhood. Risk factors include congenital anomalies of the kidneys and urinary tract, K-cut, female sex, lack of circumcision in young boys, and bladder and bowel dysfunction. As in adults, the most common causative pathogen is Escherichia coli. Children and adolescents often present with classic symptoms of UTI, example dysuria, urinary frequency. However, nonverbal and/or young children often have nonspecific symptoms, which may include fever, irritability, poor feeding, and new-onset urinary incontinence. Diagnosis is based on symptoms and urinalysis and urine culture results. Imaging is not required for diagnosis but is used to evaluate for suspected acute complications, example renal abscess, and underlying structural anomalies, example vesicoureteral reflux. The first-line imaging modality is renal and bladder ultrasound, RBUS. Further imaging depends on the patient's history, ultrasound results, and/or specialist recommendations. Treatment of pediatric UTIs involves antibiotics, oral or 4, and management of any underlying causes. Recurrent UTIs are common in children, and patients and/or their caregivers should be educated on preventive measures. Complications of pediatric UTIs, especially if severe or recurrent, include sepsis, renal scarring, chronic kidney disease, and hypertension. UTI in adults is discussed in a separate article, see urinary tract infections. OSOES. Epidemiology. Scent UTIs are common in children, up to 7% of girls and 2% of boys are diagnosed with a UTI by 6 years of age. 2 Cent 3 colonase asterisk equals 12 months of age, 2/7. Epidemiological data refers to the U.S., unless otherwise specified. WA. OES. Etiology. Pathogen/1L4. Scent bacterial copyright Escherichia coli, in up to 90% of cases, E. Klebsiella pneumoniae copyright Proteus mirabilis, 3, copyright Enterococcus faecalis O. Enterobacter species copyright rarely, Pseudomonas aeruginosa, Group B Streptococcus, Staphylococcus aureus, 4 cent non-bacterial copyright viral, Adenovirus 540 fungal, rare Candida, Cryptococcus neoformans, Aspergillus ma. UTIs caused by a pathogen other than E. coli are considered atypical pediatric UTIs. SLL6. Risk factors for pediatric UTI 3. Alleged female sex personal or family history of KCUT1E bowel and bladder dysfunction, example chronic constipation, 72, instrumentation of the urinary tract 3 cent children. VAOE. Clinical features. Back collapse fine text outline. Clinical features. Scent clinical features of UTI in children and adolescents are similar to those in adults, e.g., urinary frequency dysuria copyright suprapubic pain flank pain fever, 1/SIL2L scent caregivers may report the following in young children: new onset urinary incontinence, if toilet trained, 3 irritability 12 degree crying when urinating 2 degree poor feeding, 2 degree malodorous urine, 121 degree neonates, jaundice, hypothermia, SII6. Copyright symptoms of a pediatric UTI may be nonspecific, fever may be the only sign, particularly in neonates. 312. Diagnostics. Approach to I-14-215. Scent determine the need for urinalysis based on age and clinical features. Indications include 14 copyright age 24 months with clinical features of pediatric UTI scent send urine culture if copyright urinalysis is positive, copyright urinalysis is negative but clinical suspicion is high. 14 scent imaging studies are required for copyright children aged. The diagnosis of UTI typically involves urinalysis, may detect bacteria and/or pyuria, and urine culture, confirms bacteriuria. Collection methods, 4LL3. Scent not toilet trained copyright preferred, sterile collection, example transurethral catheterization or suprapubic aspiration. 14 copyright alternatives, clean catch urine sample or bagged urine sample, not suitable for culture, Si-lolhnaline, equals a negative urinalysis result can rule out a UTI. Equals if positive, obtain a sterile sample for culture. Scent toilet trained, clean catch urine sample. Urinalysis 1. Asterisk dipstick urinalysis 2 and 5. Copyright positive urinary nitrites, suggests bacteria. Copyright positive leukocyte esterase, suggests pyuria. Microscopy, presence of bacteria on gram stain and/or pyuria. 3, equals do AIOE, v. 14, 3-2. Outline. Urine culture. Scent significant bacteriuria confirms the diagnosis. Thresholds vary based on collection method and across guidelines, follow local protocols. ALTE copyright midstream clean catch, 100,000 CFU/ml, 1, 6LL2 at 3, copyright transurethral catheterization or suprapubic aspiration, 50,000 CFU/ml. OLL 14 imaging in pediatric UTI. Plus first febrile UTI in children aged. Copyright most abnormalities can be detected on RBUS but VCUG is required if vesicoureteral reflux is suspected. See diagnostics of VUR for further information. A 7OE. Treatment. Sent start empiric antibiotics for pediatric UTI, example cephalosporins, while awaiting urine culture results. Sent adjust treatment when culture results become available. Sent provide supportive treatment, example analgesia, supportive care for pediatric fever. Sent if fever persists for 72 hours, consider urgent imaging for pediatric UTI to rule out renal abscess. 3. Educate patients and caregivers on prevention of pediatric UTI. Plus vulvovaginitis, example from poor hygiene, irritation, C2 21122 plus appendicitis or mesenteric lymphadenitis, 221 I23, plus diabetes mellitus or diabetes insipidus, may cause urinary frequency, 21 plus genital injury, 24 sexually transmitted infections, 21. Copyright consider sexual assault in all pediatric patients presenting with genital injury or sexually transmitted infections, in adolescence, screen for signs of human trafficking. The differential diagnoses listed here are not exhaustive. WAOE. Complications. Plus acute 1L2E dehydration and hypovolemia copyright sepsis E renal abscess copyright acute kidney injury * chronic, due to recurrent UTIs, 2 copyright renal scarring 21 copyright chronic kidney disease O hypertension in children we list the most important complications. The selection is not exhaustive. WI 3s. Back collapse find text outline. WAOE. Treatment sent start empiric antibiotics for pediatric UTI, example cephalosporins, while awaiting urine culture results. Sent adjust treatment when culture results become available. Provide supportive treatment, example analgesia, supportive care for pediatric fever. Sent if fever persists for 72 hours, consider urgent imaging for pediatric UTI to rule out renal abscess. 3. Educate patients and caregivers on prevention of pediatric UTI. OO and differential diagnoses. Plus vulvovaginitis, example from poor hygiene, irritation, 2211-1221 plus appendicitis or mesenteric lymphadenitis 22,123, diabetes mellitus or diabetes insipidus, may cause urinary frequency, L21 copyright genital injury, 24, plus sexually transmitted infections, 21. Consider sexual assault in all pediatric patients presenting with genital injury or sexually transmitted infections, in adolescence, screen for signs of human trafficking. The differential diagnoses listed here are not exhaustive. Complications. Acute LL2 copyright dehydration and hypovolemia copyright sepsis or renal abscess copyright acute kidney injury * chronic, due to recurrent UTIs, 2. Copyright renal scarring 2 copyright chronic kidney disease O hypertension in children we list the most important complications. The selection is not exhaustive. As soon as plus S the weight of life holds me down in pain tuvu. Fe, CES. Prevention. Educate caregivers on nonspecific symptoms of pediatric UTI and the need to seek early treatment. Promptly identify and treat any underlying conditions including, copyright bladder and bowel dysfunction, C. Constipation in children and adolescents, 2 IL-10 copyright K-cut, example hydronephrosis, vesicoureteral reflux, * encourage children to urinate regularly. 1/9. OSCE. Tips and links. Sources. Last updated September 1, 2023. Back collapse find text outline. Antiseptic. Suprapubic aspiration in infants, materials, he. Realdl even when T pass through time VEANT stands sterile materials, A. Gloves, B. Tray, C. Gauze, D. forceps, E. Fenestrated drape, F. 5 ml syringe and 22 gauge needle, G. EMLA topical anesthetic cream, H. Occlusive dressing non-sterile materials, I. Surgical mask, J. Antiseptic solution copyright Boss. 042. Oyok equals at 171 pounds. HLJ live a life depending on you, VLE hold on suprapubic aspiration in infants, technique. 1. A topical anesthetic, example EMLA cream, is applied to the aspiration site, in the midline approximate 1 to 2 cm cranial to the pubic symphysis. The area is covered with an occlusive dressing, example Tegaderm, and the anesthetic is allowed to act for approximately 30 minutes before proceeding. 2. An assistant holds the infant's legs in a frog-legged position, i.e., hips and knees are flexed and hips are externally rotated. 3a. After removal of the occlusive dressing and wiping away the remaining anesthetic, not pictured, ultrasound is used to confirm bladder location. Note that needle insertion may also be performed under real-time ultrasound guidance, in which case a sterile cover is required for the ultrasound probe. 3b. Using sterile forceps and sterile gauze soaked in an antiseptic solution, the skin is cleaned from the pubic symphysis to the umbilicus and the antiseptic is allowed to air dry. 4. The cleaned area is covered with a sterile fenestrated drape. The aspiration site is marked by placing 2 fingers above the \S, QS, SSES equals SS to U, Jesus suprapubic aspiration in infants, technique. 4. The cleaned area is covered with a sterile fenestrated drape. The aspiration site is marked by placing 2 fingers above the pubic symphysis. This may be done by a second assistant as shown here, or by the clinician themselves. 5. The clinician inserts a 22 gauge needle attached to a 5 ml syringe perpendicular to the abdominal wall. This usually means aiming approximate 10 to 20 degrees caudally from true vertical due to the slope of the abdominal wall. 6. While ASPI rating, the needle is advanced 2 to 3 centimeters until urine appears in the syringe. A minimum of 2 ml of urine should be collected. Following the procedure, the needle and syringe are withdrawn, the needle safely removed from the syringe, and the urine emptied into a sterile urine collection cup. The cup is then placed in a specimen transport bag and sent to the laboratory. Note: in older children and/or children with thicker abdominal walls, additional subcutaneous infiltration of local anesthetic is preferred over a topical anesthetic alone. This is performed between steps 4 and 5 using a sterile technique. \XA equals E, A. \J, N /J, FP AAXHKKWS KISS Pi AA, Y. Voiding stimulation technique for clean catch urine in infants. K your eyes away from me ol ahil boa nyo never nx4es illustration depicting a voiding stimulation technique to accelerate the collection of a clean catch, i.e., midstream, urine sample in an infant. It is also known as the quick wee method. Sterile materials: A. Urine collection cup, B. Forceps, C. Surgical swab. Non-sterile materials: D. Towel, cloth, or urine towelette. 1. The caregiver may offer a bottle or breastfeed before the procedure. 2. The urethral opening, and perineum, if female, is cleaned, first with an antiseptic and then with sterile water. 3. Using a cold saline-soaked gauze held with forceps, the suprapubic area is gently rubbed in a circular motion while holding the collection cup. No pressure is required. The cold and wet stimulus is thought to trigger cutaneous voiding reflexes. 4. Urine is collected without skin contact to avoid contamination. 1-2. I'm WL/F add. A and 3A. Bagged urine collection technique in infants. Sterile materials: A. Urine collection cup. B. Urine collection bag, example U-bag. Non-sterile materials: C. Specimen transport bag. D. Towel, cloth, or urine towel. At 1. The urethral opening and perineum are cleaned, first with an antiseptic and then with sterile water. 2. The urine collection bag is opened and the adhesive sticker removed without touching the adhesive collar underneath. 3. The adhesive collar is applied to the skin of the genital area by pressing on the non-adhesive side of the collection bag and gently pulling down on the bag to open it. To prevent leakage and contamination, it is essential to ensure the adhesive has fully adhered around the entire collar without skin folds or gaps. The urethral opening and labia of female children, 3A, and the penis and scrotum of male children, 3B, must be inside the opening of the bag. 4. After the child has urinated, the bag is held above a sterile urine collection cup and opened, either via a dedicated mechanism, example by pulling the blue square tab on a U-bag, or by cutting the bottom corner with sterile scissors. The urine is I2. I. VE, TI EESY, $J7. RAY. 3A. Bagged urine collection technique in infants. OIS S equals R 2128. ARIA as AILI. A life living in Jesus. You take charge of my life. 1. The urethral opening and perineum are cleaned, first with an antiseptic and then with sterile water. 2. The urine collection bag is opened and the adhesive sticker removed without touching the adhesive collar underneath. 3. The adhesive collar is applied to the skin of the genital area by pressing on the non-adhesive side of the collection bag and gently pulling down on the bag to open it. To prevent leakage and contamination, it is essential to ensure the adhesive has fully adhered around the entire collar without skin folds or gaps. The urethral opening and labia of female children, 3A, and the penis and scrotum of male children, 3B, must be inside the opening of the bag. 4. After the child has urinated, the bag is held above a sterile urine collection cup and opened, either via a dedicated mechanism, example by pulling the blue square tab on a U-bag, or by cutting the bottom corner with sterile scissors. The urine is drained into a sterile cup without the bag touching the cup. The cup is then sealed with its lid, placed inside the specimen transport bag, and sent to the laboratory. Kurentaknen abstrefen, Abelsen knock, wel remove excess urine, read the Sumeria yevament, eliminate l excess de nt in mergit repeatment, eguder, lire entre cori phi. Urinalysis, urine analysis, test strip. Left, test strip following immersion in urine ES, equals L1 give my all to. You right, test strip packaging with instructions on how to interpret findings. Source, Urine Quick Test by Uwe Gill, Wikimedia Commons, licensed under CC by SA 3.0. AF9 SUT and the weight of life holds Syme down in pain pyuria and bacteriuria on microscopy. Photomicrograph of a urine specimen, high magnification, multiple white blood cells, large, light-colored structures, and bacteria, small black structures, are visible. The presence of white blood cells, pyuria, and bacteria, bacteriuria, in the urine is characteristic of urinary tract infection. Source, Bacteriuria Pyuria 4 by Stephen Fruitsmock, Wikimedia Commons, licensed under CC by SA 3.0. X. Pediatric fever. Fever, which is defined as a core body temperature equals 100.4 degrees Fahrenheit or 38 degrees Celsius, is one of the most common causes of pediatric healthcare visits. Fever is the body's normal response to an underlying infection and/or inflammatory process, example rheumatologic conditions, malignancy. Following the introduction of routine childhood pneumococcal vaccines and H. influenza type B, HIB, vaccines, acute pediatric fevers in children aged 60 days are most commonly caused by self-limited viral infections. Diagnostic studies are not usually required but should be performed if any red flags for pediatric fever are present to identify serious bacterial infections. Children who have risk factors for life-threatening pediatric infection require additional evaluation, even if they appear well on examination, and may require antibiotics and hospital admission. Supportive care is the mainstay of treatment for children with fever and should include adequate hydration and antipyretics for discomfort. Education for caregivers is important to reduce anxiety over fever in children and help manage future episodes at home. Fever in infants. OOE. Epidemiology. Fever is the presenting concern in 30% of pediatric primary care visits, 15% of emergency room visits in children. Epidemiological data refers to the U.S., unless otherwise specified. WA. CE. Etiology. Fever is a symptom of an underlying infection, disease, and/or inflammatory process. Suspected causes of fever differ according to each system, see also differential. Diagnoses of fever by affected system. 3. Infectious causes of pediatric fever. 4. Common infectious conditions include urinary tract infection in children, most common bacterial infection in children. Degree plus less common causes include 71 copyright rickettsial infections, example tick-borne diseases, typhus, copyright tropical diseases, malaria, dengue fever, Zika virus, chikungunya virus, copyright tuberculosis, copyright cat scratch disease. He B equals L as th even when J pass through time cane stand non-infectious causes of pediatric fever 81L4. Post-vaccination fever, heat stroke, drug fevers, thyrotoxicosis, intracranial pathology, rheumatologic conditions, EO Kawasaki disease, O periodic fever, aphthous stomatitis, pharyngitis, Adenitis syndrome, FAPA, copyright juvenile idiopathic arthritis, CHIA, copyright multi-system inflammatory syndrome in children, MIS-C, malignancy, example leukemia, lymphoma. PE. Back collapse, fine text outline. Clinical features. Common findings. Scent physiological adaptations to fever, e.g., copyright tachypnea, copyright tachycardia, O flushed skin, copyright shivering or sweating, copyright peripheral vasoconstriction, scent associated behavioral changes, e.g., O decreased activity, copyright fussiness or irritability, scent clinical features of the underlying condition, see etiology of pediatric fever. E. Rectal temperature is the best indicator of core temperature. 5. WI. CES. Diagnostics. The following information pertains to infants 60 days of age. For diagnostics for younger infants, see fever in infants 60 days of age. General principles. Scent in well-appearing children, a diagnosis can often be made clinically after a thorough history and examination. When required, diagnostics for fever are usually evaluations for the suspected etiology. Scent in fever of unknown source, consider more extensive diagnostic studies, particularly in children. Initiate treatment without awaiting the results of diagnostic studies in children with suspected serious bacterial infections. Evaluations for suspected etiology. Scent based on the clinical examination, evaluate for suspected conditions, e.g., Copyright Diagnostics for UTI in Children. Copyright Diagnostics of Pneumonia in Children. Copyright Diagnostics of Infectious Gastroenteritis in Children. Copyright Diagnostics for Meningitis in Children. Copyright Diagnostics of Sepsis. Copyright Diagnostics for Acute Tonsillitis and Pharyngitis. And see also Etiology of Pediatric Fever. Unclear source /IL-1226. Initial investigations for acute fever focus on infectious causes. If test results are negative, consider non-infectious causes of pediatric fever. Children with red flags for pediatric fever. Sent blood tests. Copyright blood culture. Copyright inflammatory markers, procalcitonin, CRPANC on CBC. Copyright if CSF studies are performed, obtain serum glucose. Sent urine studies, urinalysis with reflex urine culture. Sent CSF studies, if neurologic symptoms or signs of meningitis are present. When possible, obtain cultures before initiating empiric antibiotic therapy. Pays He 22, Prever, Take Your Eyes Away, number 2 well-appearing children. Sent 2 months 3 years of age, obtain diagnostics for pediatric UTI. 6. Consider, a rapid influenza test during flu season, see diagnostics for influenza. Copyright COVID-19 test 131. Copyright chest x-ray if there are signs of pneumonia. 5. Back collapse. Find text outline. 2 months 3 years of age, obtain diagnostics for pediatric UTI. 4. 6. Consider, a rapid influenza test during flu season, see diagnostics for influenza. Copyright COVID-19 test. 3. Copyright chest x-ray if there are signs of pneumonia. 5. AA and management. The following information pertains to infants 60 days of age. For management in younger infants, see fever in infants. Sent evaluate for red flags for pediatric fever and if present, copyright provide immediate hemodynamic support. Initiate immediate broad-spectrum empiric antibiotics, see treatment. Copyright perform diagnostic studies for pediatric fever. Sent provide supportive care for pediatric fever. Copyright in children with red flags for pediatric fever, do not delay treatment for diagnostic studies. Treatment, treat the underlying cause. Sent give empiric antibiotics to children with red flags for pediatric fever and or risk factors for life-threatening pediatric infections. Copyright tailor to the suspected source, e.g., empiric antibiotics for UTI in children, empiric antibiotics for pediatric CAP. Copyright if the source is unclear, give ceftriaxone. IL-12 IL-14 supportive care for pediatric fever, 151 L16. Ensure adequate fluid intake via oral or 4 fluids. Maintain a comfortable room temperature and dress the child in light clothing. If fever is bothersome to the child, consider 1. Copyright antipyretics equals acetaminophen, 16. Ibuprofen. Copyright lukewarm sponging or bathing, 16. Sent provide anticipatory guidance for pediatric fever. To prevent Rye syndrome, avoid aspirin and medications that contain salicylate in children. 16. Antipyretics do not prevent febrile seizures. 1710. Copyright do not administer ice baths or rubbing alcohol to reduce fever. 7518. GF Year V0. OE. Prevention. Fever is part of the normal immune response to illness. To prevent infections, encourage parents to stay up to date on recommended immunizations in children. Practice rigorous hand hygiene and respiratory hygiene. RISOS. Tips and links. V. Back collapse. Find text outline. XX fever in infants. Fever in infants. Strategy risks iatrogenic harm from over-investigation and treatment. For management of fever in children and infants 60 days of age, see pediatric fever. O. And epidemiology. Every year approximately 100,000 infants. WA. And etiology. Plus, similar to older children, see etiology of pediatric fever. However, severe infections are more common. ALS, plus invasive bacterial infections can occur secondary to 6LL70 E. coli. Copyright S. galactii, Group B. Streptococcus, OL monocytogenes OS aureus O. enterococcus. Species viral infections that are typically mild can be life-threatening for young infants, e.g., 2. 7. Copyright neonatal HSV infection O. Severe VZV infection. Fever in neonates can also result from dehydration. 8. Copyright infants. WA. CE. Clinical features. Febrile infants with serious infections may be well-appearing or only show nonspecific symptoms, e.g., Raj 12. Copyright abnormal vital signs. Copyright poor feeding O. irritability or excessive sleepiness. 5. 3. O. abnormal appearance O. full fontanelle *. See also clinical features of pediatric fever. O. Appearance is unreliable in neonates and infants. OC. CE. Management approach. Scent. Obtain a full history, including birth history, examine the child, and obtain vital signs. Scent. Look for specific sources of infection, example cellulitis, if present, follow established treatment for that condition. 2. OAEYEEEEE. Back collapse. Find text outline. Scent. Obtain a full history, including birth history, examine the child, and obtain vital signs. Scent. Look for specific sources of infection, example cellulitis, if present, follow established treatment for that condition. 2. If there is no clear source of infection, O. Assess whether the infant is ill-appearing or looks well. 19. Copyright determine exact age. Management of well-appearing infants depends on age. OS. 004. Initial management of ill-appearing febrile infant. 7. IL9. Admit to hospital. Scent. Obtain full sepsis workup including CSF analysis. Start empiric parenteral antibiotic therapy. 270E. Initial management of well-appearing febrile infant. Overview. 2. The advice below is based on AAP guidance and applies to well-appearing infants without a recognizable serious source of infection. 2. Copyright significant past medical history. Copyright a history of immunization within the preceding 48 hours, if equals 8 days of age. 2. Thoroughly evaluate all infants including those with nonspecific symptoms and / or minor infections, to exclude bacteria co-infection. Scent. Diagnostic and treatment recommendations differ by age, i.e., 8 to 21 days, 22 to 28 days, and 29 to 60 days. Diagnostic studies for febrile infants. All infants. Scent. Inflammatory markers. Abnormal inflammatory markers in infants 0.5 ng/ml. Copyright CRP 20 mg/LOANC 4000 to 5200 O. Temperature 38.5 degrees Celsius, 101.3 degrees Fahrenheit. Scent. Blood culture urinalysis with reflex urine culture. 4. Copyright inflammatory markers are not required in 8-21-day-old infants since empiric 4 antibiotics are always started in this age group. However, inflammatory markers can guide management. 21. Select infants, depending on age and clinical status. CSF analysis. 2. Initial disposition and treatment. Provide supportive care for pediatric fever. Scent. Further management is based on age and laboratory studies. Overview of management of fever in infants. 22 to 28 days recommended for most patients. Scent usually, select patients may be managed at home. Required if urine or CSF abnormal. Scent required if CSF abnormal 29-60 days. Asterisk consider for other patients. Asterisk consider for all other patients. Back collapse. Find text outline. Degree 09 pounds 0 U gaze, consider if inflammatory markers are abnormal. HSV testing in infants, if red flag features for HSV in infants are present. Initial disposition and treatment. Provide supportive care for pediatric fever. Further management is based on age and laboratory studies. Overview of management of fever in infants. 22 to 28 days recommended for most patients usually, select patients may be managed at home. Asterisk required if urine or CSF abnormal. Required if CSF abnormal 29 to 60 days. 3 asterisk consider for other patients. Asterisk consider for all other patients. WA. CE. Ongoing management. Tailor antimicrobial therapies if a pathogen is isolated. Infant improving 21. Identified pathogen, continue treatment per guidance. All other patients. Copyright stop empiric antibiotics if blood and CSF cultures are negative at 24 to 36 hours. Copyright discharge home if equals clinical appearance is good equals HSV PCR studies, if scent, are negative infant not improving too. If the patient is not improving and or worsening, scent start antibiotics, if not already started, or broaden antimicrobial coverage. Consider non-bacterial infections, example HSV, fungal infections, and alternative causes of fever, see etiology. In febrile infants. WARO, EXO. Prevention. Scent encourage pregnant patients to have recommended immunizations in pregnancy. 18 prevent vertical transmission of infections to newborns. O for early onset group B streptococcal infections, ensure appropriate, equals maternal GBS screening intrapartum prophylactic antibiotics for GBS equals monitoring of newborns at risk for GBS infection. Copyright congenital and neonatal HSV infections, see prevention of neonatal HSV infection. Prevent transmission to or from infants. Copyright practice rigorous hand hygiene and respiratory hygiene, especially around at-risk populations. Copyright follow guidance on when it is safe to return to daycare following an infection. OSCES. Tips and links. Sources. Last updated October 31, 2023. Back collapse. Find text outline. X. Neonatal conjunctivitis. Neonatal conjunctivitis is inflammation of the conjunctiva in infants. Income countries because of the implementation of comprehensive preventive measures, i.e., counseling on sexually transmitted infection prevention, antenatal screening and treatment of infections, and prophylactic antibiotics at birth. OLO. Overview. Overview of conjunctivitis in newborns. ALS. NIGI conjunctivitis S1L4LL2L Sentidae conjunctivitis/INHSV conjunctivity 2 Asepti 1. Etiology and gonorrhoea, highly contagious, C. Trachomatis serotypes DK HSV1 and HSV2 usually due to silver nitrate exposure. SARC. Typically 2 to 5 days. Typically 5 to 14 days plus usually up to 14 days 2 plus usually the first day. Scent unilateral or bilateral scent purulent or mucopurulent ocular 2, praise similar to gonococcal conjunctivitis in discharge, may be blood-stained os non-purulent ECUAR discharge clinical other age groups and L gomel ulceration 5 acarinitae and features scent periocular vesicles scent mild conjunctival injection profuse, Purulent ocular discharge * eyelid edema may exhibit other features of neonatal HSV infection, example meningoencephalitis * pronounced eyelid swelling bulbar conjunctival. Injection concurrent infection of nasopharynx, genitals, or lungs. * gram stain of conjunctival exudate. Scent PCR usually clear efficient hist direct fluorescent antibody tests and what buso ms ARI perform diagnostic studies for neonatal direct fluorescent antibody test and conjunctivitis to rule out infectious enzyme immunoassay causes. 2 degrees increased WBC's viral cultures diagnostics. *PCR copyright intracellular gram-negative diplococci scent culture of the conjunctiva, and gonorrhoea. 4 or IM third generation cephalosporin oral erythromycin treat concurrent chlamydial infection if treat concurrent gonococcal treatment present. Infection if present. Provide treatment of gonorrhea to mothers. Treat genitourinary chlamydia in and at-risk partners. Mothers and at-risk partners. For acyclovir, 2, specialists may consider adjunctive flush eye with saline. Topical antivirals. See also neonatal HSV. Prenatal screening and treatment for maternal infection. Routine antibiotic prophylaxis within 1 hour of birth with erythromycin ointment, 2-6. Prenatal screening and treatment. Scent prenatal screening and treatment for avoidance of silver nitrate solution as for maternal infection prophylaxis for conjunctivitis prevention. A. Hi. WA. CES. Epidemiology. Scent prevalent in resource-limited countries, significant cause of pediatric blindness in these countries. 5. Scent incidence in the U.S. is approximately 71. Eochlamydial neonatal conjunctivitis, 2.1 per 100,000 live births. Copyright neonatal gonococcal conjunctivitis, 0.2 per 100,000 live births. Scent 30 to 50% of infants born to mothers with gonorrhea or chlamydia will develop neonatal conjunctivitis. 7. Epidemiological data refers to the U.S., unless otherwise specified. Back collapse. Find text outline. X. Neonatal conjunctivitis. Epidemiology. Scent prevalent in resource-limited countries, significant cause of pediatric blindness in these countries. 5. Scent incidence in the U.S. is approximately 7. Copyright chlamydial neonatal conjunctivitis, 2.1 per 100,000 live births. Copyright neonatal gonococcal conjunctivitis, 0.2 per 100,000 live births. Scent 30 to 50% of infants born to mothers with gonorrhea or chlamydia will develop neonatal conjunctivitis. 7. Epidemiological data refers to the U.S., unless otherwise specified. Y. OE. Etiology. Scent transmitted perinatally via exposure in utero or during vaginal delivery. Common pathogens include 2I, S, degree bacteria Chlamydia trachomatis, most common, Neisseria gonorrhoeae Pseudomonas aeruginosa, common in premature infants, Streptococcus pneumoniae Haemophilus influenza O viruses herpes simplex virus adenovirus. WA. OIEEE. Clinical features. Scent develop within 2 to 28 days of birth, dependent on etiology. +2 common features include 2. Copyright conjunctival injection eochemosis O eyelid edema. Copyright ocular discharge, may be watery, blood-stained, or purulent. 5. May be accompanied by systemic symptoms depending on the causative pathogen. Lal Sid. 4. Copyright HSV, vesicular rash, meningoencephalitis, CHSV infection in the newborn, Pseudomonas, sepsis, meningitis O and gonorrhoeae, sepsis, arthritis, meningitis, C. Disseminated gonococcal infection. Infants infected with C. trachomatis may present with pneumonia 3 weeks to 3 months after birth. This may be after conjunctivitis has resolved. 2. OE. Complications 2I5. Scent endophthalmitis, scent corneal perforation, scent blindness, scent disseminated infection, meningitis, sepsis. We list the most important complications. The selection is not exhaustive. Back collapse, fine text outline. Infant with gonococcal ophthalmic disease. The eyelids are swollen, with purulent exudate forming crusts around them. Below the crusts there may be a large reservoir of pus. Special care should be taken and safety goggles should be worn when examining the eyes. Source: ID hashtag 3766, CDC/J Pledger, Centers for Disease Control and Prevention, CDC, licensed under public domain. Herpes simplex keratitis. Slit lamp photography with fluorescein stain and cobalt blue light filter. Dendritic lesions of the cornea appear green under cobalt blue illumination after fluorescein stain. These lesions are characteristic of keratitis caused by herpes simplex virus, HSV. Source: Dendritic corneal ulcer by Imran Kabir Hossain, Wikimedia Commons, licensed under CC by SA 4.0. Chlamydia trachomatis in McCoy cell culture. Photomicrograph of cells in McCoy cell culture, unknown magnification, cells infected with Chlamydia trachomatis, black arrows, show inclusion bodies, reticulate bodies, here in brown, under the microscope. Chlamydia are obligate intracellular bacteria that require cell culture, rather than growth medium, to grow. This characteristic is especially important for determining the best antibiotic for treatment. Source: ID hashtag 6428, CDC/Drive E. Aram, Drive N. Jacobs, Centers for Disease Control and Prevention, CDC, licensed under public domain. Uroneonatal conjunctivitis, 4/4. Chlamydia trachomatis in McCoy cell culture, magnified view. Photomicrograph of cells in McCoy cell culture, 200x magnification. The cells infected with Chlamydia trachomatis, example circled in blue, are identifiable by inclusion bodies, brown, example marked by hatched overlay, surrounded by a thin rim of host cytoplasm. Over the course of the pathogen's life cycle, elementary bodies, examples circled in white, are formed within the inclusion bodies. These are released from the cell and serve to transmit the pathogen to other cells or hosts. Source: ID hashtag 3802, CDC/Drive E. Aram, Drive N. Jacobs, Centers for Disease Control and Prevention, CDC, licensed under public domain. Neonatal conjunctivitis, 4/4. Chlamydia trachomatis in McCoy cell culture, magnified view. Photomicrograph of cells in McCoy cell culture, 200x magnification. The cells infected with Chlamydia trachomatis, example circled in blue, are identifiable by inclusion bodies, brown, example marked by hatched overlay, surrounded by a thin rim of host cytoplasm. Over the course of the pathogen's life cycle, elementary bodies, examples circled in white, are formed within the inclusion bodies. These are released from the cell and serve to transmit the pathogen to other cells or hosts. Source: ID hashtag 3802, CDC/Drive E. Aram, Drive N. Jacobs, Centers for Disease Control and Prevention, CDC, licensed under public domain. Infant with gonococcal ophthalmic disease. The eyelids are swollen, with purulent exudate forming crusts around them. Below the crusts there may be a large reservoir of pus. Special care should be taken and safety goggles should be worn when examining the eyes. Source: ID hashtag 3766, CDC/J Pledger, Centers for Disease Control and Prevention, CDC, licensed under public domain. Neonatal herpes simplex. Scalp of a 9-day-old newborn. Multiple partially confluent vesicles on an erythematous base are visible on the right frontotemporal aspect of the scalp. Further erythematous patches can be seen over the right temple and forehead. Source: Herpes neonatal herpes simplex by Copitane Cavern, Wikimedia Commons, licensed under CC by SA 4.0. X. Respiratory syncytial virus infection. Respiratory syncytial virus, RSV, is an enveloped RNA virus that infects the respiratory tract. RSV is one of the most common causes of respiratory infections. In healthy adults and older children, RSV typically manifests as a mild upper respiratory tract infection, URTI. Infants, young children, older adults, and individuals with other risk factors for severe RSV infection are more likely to develop a lower respiratory tract infection, LRTI, and/or require hospitalization. RSV-associated conditions are typically diagnosed clinically without the need for pathogen confirmation. Diagnostic testing, example RSV PCR, chest X-ray, may be indicated in individuals with severe illness, risk factors for severe RSV infection, or suspected alternative diagnoses or complications. Management is generally supportive and focuses on the treatment of the associated condition. Primary prevention includes the RSV vaccine, for pregnant individuals and older adults, and RSV prophylaxis, for infants and young children. See also bronchiolitis. OFA, CES. Epidemiology. Almost all individuals have had an RSV infection by 2 years of age, and reinfection can occur throughout life. 1. A significant cause of morbidity and mortality in young children and older adults. Copyright the most common cause of hospitalization, bronchiolitis, and pneumonia in infants. 6 Ls, O responsible for 20% of all ER visits in children. Copyright RSV morbidity and mortality rates follow a bimodal age distribution. Infants, young children, and older adults are most severely affected. 2. Epidemiological data refers to the U.S., unless otherwise specified. WA. CE. Etiology. The RSV virus is an enveloped, non-segmented, negative-stranded RNA virus 5O pneumoviridae family, Orthopneumovirus genus, human Orthopneumovirus species. O has 2 antigenic subtypes, A and B. 1-5 virulence factors. Copyright glycoprotein G, mutates often 5LL2IO RSV fusion, F, protein, typically conserved scent transmission. Copyright transmitted via direct contact with respiratory droplets and indirect contact with contaminated surfaces, City. Copyright the incubation period is 2 to 8 days. /SILT-I7 Copyright viral shedding typically lasts 3 to 8 days. 2/SIL-7 Copyright in the U.S., RSV season has historically occurred from fall through early spring. 1. LO. The RSV vaccine targets the RSV fusion, F, protein, as it rarely mutates. 5. VM. CE. Risk factors. The following risk factors are associated with severe RSV infections, typically LRTIs. Risk factors for severe RSV infection in children: L5I1 11-12. Plus chronological age. Back collapse fine text outline. Plus environmental factors. For copyright child care attendance. O exposure to tobacco smoke. 13 Cent for information on RSV prevention in children with risk factors, see RSV prophylaxis. Most children who are hospitalized with RSV infection are otherwise healthy with no previous medical conditions. L2L54. Risk factors for severe RSV infection in adults. 41 Cent older age equals 60 years, especially equals 75 years. 4 plus comorbidities. 15 EO immunocompromised state example from medical conditions or use of medications sent living in a long-term care facility, reduced functional capacity or frailty. For information on RSV prevention in adults with risk factors, see RSV vaccine and immunization schedule. Clinical features. Asterisk symptoms of nonspecific viral illness /5IL-71 lethargy or fatigue irritability decreased appetite fever he's as AE even when passed through time one can't stand symptoms of upper respiratory tract infection, SE17 copyright rhinorrhea is often thick and copious in infants. 4 acute otitis media occurs in up to 60% of children with RSV. Symptoms of lower respiratory tract infection, SFLT70 all patients, cough, tachypnea, rales, wheezes, crackles copyright in young children, clinical features of bronchiolitis, clinical features of pediatric pneumonia in older children and adults, clinical features of acute bronchitis, clinical features of pneumonia signs of severe RSV infection, signs of respiratory distress, hypoxemia, and, in young infants, apnea 1. CE. Diagnostics. Diagnostic testing for RSV is not routinely indicated but can be considered depending on clinical features. 17 confirmatory testing /IL-171 I-18. If indicated, RSV can be identified in samples from the upper or lower respiratory tract using any of the following: nucleic acid amplification test, example reverse transcription PCR, preferred, S17 plus rapid antigen detection test, young children only, /5IL-17 cent viral culture, rarely used, 5 chest X-ray, 1 IL-9. Radiography is not routinely indicated. Findings may include the following: 1. Scent nonspecific findings, peribronchial thickening, pulmonary hyperinflation scent chest X-ray findings in bronchiolitis scent chest X-ray findings in pneumonia. V equals A. Back collapse find text. O. Outline. Management. Management depends on disease presentation and severity. Supportive care 511-9117. Scent cool mist humidifier or steamy showers. Scent antipyretics for fever and or discomfort. Encourage adequate fluid intake. If unable to tolerate oral fluids, provide NG/4 fluids. Scent gentle nasal suctioning in infants. Pharmacotherapy. Plus antibiotics, only indicated for a confirmed bacterial co-infection or superinfection, 2-H-Ilsil-18. WA. OE. Prevention. General principles /LL1. Plus recommend the RSV vaccine in older adults /4 cent to decrease the risk of infection in children. Encourage, copyright RSV vaccination during each pregnancy. 23E exclusive breastfeeding for infants. 10 RSV prophylaxis for eligible young children. G42. Omer equals at 111 pounds. GJ live a life depending on you. Jill hold on copyright avoidance of tobacco smoke exposure. SF1 RSV vaccine, adults, 231 I4. Plus description, a bivalent vaccine based on the prefusion form of the RSV fusion, F, protein 24 cent indications. Copyright all pregnant individuals between 32 and 36 weeks gestation. 123 copyright adults aged equals 60 years, especially with risk factors for severe RSV infection, use shared decision making. AL 24 cent additional information. Copyright immunization schedule. Copyright immunizations in pregnancy. RSV prophylaxis, children, 251-26 I12. Monoclonal antibodies that target the RSV fusion, F, protein are used to provide passive immunization. RSV prophylaxis reduces RSV-related hospitalizations, example due to bronchiolitis, pneumonia, in infants. Scent 2 RSV monoclonal antibodies are now available. Nirsevimab, a long-acting RSV monoclonal antibody that provides protection for 5 months, administered as a single intramuscular injection during or, preferably, just before RSV season. Palivizumab, 12I11, a short-acting RSV monoclonal antibody, equals administered as monthly intramuscular injections, equals initiate administration just before and continue throughout the RSV season. 25-26-12 for RSV prophylaxis and approved agents. Indications, agent and administration. All infants. Preterm birth at palivizumab and nirsevimab provide RSV, pneumovirus, prophylaxis for pre-existing conditions, example preterm. Back collapse, fine text outline. Urorespiratory syncytial virus infection, 1/2. Viral bronchiolitis. X-ray chest, PA view, of a child with respiratory syncytial virus, RSV, extensive peribronchial thickening, examples indicated by green circles, has caused the hilar and perihilar regions to appear prominent. Additionally, the lung volumes are large as a result of air trapping. One of the radiographic features suggestive of hyperinflation is the visualization of more than 6 anterior or 10 posterior ribs above the hemidiaphragm, indicated by numbers. Source: RSV by James Heilman, MD, Wikimedia Commons, licensed under CC by SA 3.0. Modifications: removal of arrows. Urorespiratory syncytial virus infection, 1/2. Viral bronchiolitis. X-ray chest, PA view, of a child with respiratory syncytial virus, RSV, extensive peribronchial thickening, examples indicated by green circles, has caused the hilar and perihilar regions to appear prominent. Additionally, the lung volumes are large as a result of air trapping. One of the radiographic features suggestive of hyperinflation is the visualization of more than 6 anterior or 10 posterior ribs above the hemidiaphragm, indicated by numbers. Source: RSV by James Heilman, MD, Wikimedia Commons, licensed under CC by SA 3.0. Modifications: removal of arrows. Bilateral hyperinflation and right lung consolidation. JEA equals FAL1E gives me the strength endure the days. X-ray chest, AP view, of a child with viral bronchiolitis and focal pneumonia. Bilateral perihilar peribronchial thickening, examples of bronchi indicated by green lines, is accompanied by hyperinflation with diaphragmatic depression, indicated by white lines and arrow. In the right lung, a superimposed area of consolidation from pneumonia, red overlay, is associated with atelectasis and ipsilateral mediastinal shift, indicated by black arrow. Black outline, trachea, white dashed line, physiological position of left hemidiaphragm. Source: Fig 2, in, lung ultrasound for the diagnosis of pneumonia in children with acute bronchiolitis by Biaggi C., Pierantoni L., Baldazzi M., Greco L., Dormier, Dondi A., Faldelagi, ETAL, BMC Pulmonary Medicine, licensed under CC by 4.0. Modifications: image was cropped and letter A was removed. Respiratory syncytial virus infection, 2/2. Overall. Bilateral hyperinflation and right lung consolidation. X-ray chest, AP view, of a child with viral bronchiolitis and focal pneumonia. Bilateral perihilar peribronchial thickening, examples of bronchi indicated by green lines, is accompanied by hyperinflation with diaphragmatic depression, indicated by white lines and arrow. In the right lung, a superimposed area of consolidation from pneumonia, red overlay, is associated with atelectasis and ipsilateral mediastinal shift, indicated by black arrow. Black outline, trachea, white dashed line, physiological position of left hemidiaphragm. Source: Fig 2, in, Lung ultrasound for the diagnosis of pneumonia in children with acute bronchiolitis by Biaggi C., Pier Antoni L., Baldazzi M., Greco L., Dormai A., Dondi A., Faldelagi, ETA L., BMC Pulmonary Medicine, licensed under CC by 4.0. Modifications: image was cropped and letter A was removed.